All right. Wow, that's loud. Welcome to the Boise School District meeting. It is 6 o'clock on Monday, the February 8th, and I'd like to call this meeting to order. My name is Dave Wagers. I'd like to remind everybody that with the Boise School District, we follow some strict values. They include respect, dignity, honesty, responsibility, and teamwork. And we try and follow those in all of our meetings at any given time. Clerk Mass, will you do the roll?
Trustee Wagers?
Here.
Trustee Greeley?
Here.
Trustee Down?
Here.
Trustee Esty?
Here.
Trustee Gregory?
Here.
Trustee Langley?
Here.
Trustee Oppenheimer?
Here.
All present.
Thank you, trustees, for all being here, and thank you for everybody who is both in person and watching this stream today. We are trying some new technology out at the district, and so far, so good. I think everything is working. We're trying to adjust. We've able to stream better and actually work within our boardroom better with streaming at the same time. So we have issues. Be patient with us. We'll figure it out. But I think we are well tested and should be ready to go. We'll go ahead and move on to. We always like to start with Red and Gold Apple Awards, and now we do a video presentation during the pandemic, but we've got some great people in our district to recognize. So let's go ahead and roll those video presentations. Well, welcome everybody. We're here today to recognize a great employee of the Boise School District. It is our pleasure to recognize an individual who has served the children of the Boise School District for over 8 years. This person is the best possible type of employee to have on your team. Every organization has that one employee who is known as the workhorse. This person is that workhorse. He completes his work assignments on time and with a smile, and eagerly takes on more assignments and responsibilities. He is kind, generous, smart, and hardworking. He helps others out in completing tasks and helps others to be the best that they can be. This person started his career with the Boise School District as a part-time custodian. And with his workhorse attitude and positive nature, he was quickly promoted. He excelled in supervision and management, which earned him further promotions up to custodial area manager. This person is an expert in his field, and his quest for learning new things never stops. He graduated from BSU in 2020 and set his sights on the Human Resource Department. Though he is greatly missed at facilities and operations, he will continue to be a great asset for the district in this new position. This person is a dedicated leader who inspires those around him with his work ethic, his ability to think critically, and his insight into complex issues. He will dive deep into a problem, look at it from all angles, thoroughly research the issue, and provide creative solutions. He will do all of this with warmth and humor, making his colleagues feel valued and empowered to do their best. He is generous with his time and knowledge, often lending a hand in areas outside his responsibility for the benefit of all. It is our distinct honor to present the Golden Apple Award for February 8th, 2021 to Tony Day, Benefit Clerk, District Services Center for outstanding service to education and for educating today for a better tomorrow. Give me the elbow handshake, the Golden Apple, and then these, a certificate, and those perfectly written words. And the podium is yours.
Well, thank you so much, President Wagers. I really appreciate the kind words. I know those came from Tom. Thank you so much. It means so much to me. I feel honored and humbled to receive this award. And I just would like to say that this award belongs really to all of the coworkers I've had who've supported me throughout the years. Any award of mine really belongs to them as well as to the entire custodial department who've supported me as I was a custodial manager. But really, it's their tireless work over this last year that has made it possible. The fact that I can draw a crowd like this here outside in January is just amazing and humbling. So thank you all. You all mean so very much to me, and thank you.
Yay, Tom.
It is our pleasure to recognize an individual who has served the children of the Boise School District for more than 18 years. This person is a lion to the core, and Bora High School is lucky to have one of its own leading the pride. This person is many things. She is a wonderful math teacher first and foremost. She is that teacher who puts in extra time, is always willing to help her students to not only learn the math, but really understand it. She says she was not always a natural math learner, so she knows how it feels to need extra time or a different way of explaining. She is patient and flexible with her students, and she really cares about them as learners and as people. She will give students endless opportunities to succeed. She is invested in their success and has a knack for being able to meet students where they are in their learning and figure out ways to support them with compassion and empathy. This person is also Bora's math department head, and she represents her department with professionalism and care as a colleague, sounding board, and friend. She is the perfect person to lead others because she is approachable and open to input and ideas and always makes time for others. If she does not have the answers, she finds them. There is no ego involved. She helps new teachers navigate the profession, and she assists veteran teachers in honing their skills as well. Beyond teaching and leading her department, this person has been a coach, assistant athletic director, webmaster, technology and instructional lead, master schedule aficionado, and infinite campus gradebook guru. On her own time, she will often be found at sporting and extracurricular events. She has been described as a caretaker and is always willing to lend a helping hand and be of service. She is generous and appreciative, and she lets others know their thoughts and needs are important. It is our distinct honor to present the Red Apple Award for February 8th, 2021 to Allison Pincock, math teacher, Bora High School, for outstanding service to education and for educating today for a better tomorrow. Congratulations, Allison. Congratulations.
That's the first time I've heard that wonderful letter, and it means more than anyone could know. I am so grateful to work in this school district, and especially for Bora. I love it. I've had offers to go other places, and this is my home, and I plan on being here forever. So thank you so much for this award and for this opportunity, and to my school and my colleagues and everybody. I really appreciate it.
Congratulations, and here is the words that were spoken about you and your award. Congratulations.
Well, congratulations to both Tony and Allison. We really appreciate the work that you do on behalf of the school district and all of our students. So thank you once again. We'll go ahead and move on to the consent agenda items. So they've been previously distributed to the trustees. Are there any trustees that would like to pull a consent agenda item? If not, I would entertain a motion.
President Wagers? I move approval of consent agenda items 1 through 5, enclosures 1 through 19.
Moved by trustee Greeley. Do I have a second?
Second.
Second by trustee Esty, I believe.
Gregory.
Gregory, whoops. Got it. Any discussion? All in favor?
Aye.
Aye.
Opposed? Motion passes. Consent agenda items 1 through 5 have passed. And with that, we'll go ahead and move directly on to reports and recommendations. And the first part of that is going to be, we're happy to have our experts with us, I guess. So we really appreciate you showing up with us today. We have, well, actually, I'll let maybe Deputy Superintendent Roberts introduce our crew.
Thank you. Yes, we are thrilled to once again welcome Dr. Kenny Bramwell from St. Luke's Health System, Dr. Mark Nasser from St. Al's Medical Group, and Gina Pinnell from Central District Health. They've been with us a couple times this year in board meetings. However, we talk with them weekly, right? We've been doing that since August. And so we're excited they're here tonight. The board has submitted questions for all of you. I know that I sent some of those to you, but I know there may be some extra ones this evening as well. I'm going to try and rotate through each of you to start with, on who will start each question. But the very first one, I'm going to start with Dr. Nasser, then we'll move on to Dr. Brahmo and then end up with Gina Pinnell. Please give us a status update of the healthcare capacity of the hospitals, cases the hospitals are seeing, Ada County community spread trends, etc. We'll start with you, Dr. Nasser.
Thank you, Deputy Roberts. It's a pleasure to be with the board and to be able to participate with this team collaboratively. So the hospitals thankfully are in a better state than we were immediately post-Christmas holiday when we really had peaked, and we've been in a steady improvement in the number of cases admitted to our health system and the number of the most ill of those, which are ICU patients. And so we continue to have somewhere between 5 and 10% of our hospital beds filled with COVID patients. So it's still not an insignificant number, but thankfully it has been either steady or declining in recent days and weeks. I would say that that's enabled us to increase our capability in the hospital to handle additional cases of patients who need to be admitted, also additional surgical cases that we previously had suspended or put on hold. Those have been able to be opened back up, allowing us more capacity there. And we're seeing, in a like manner, the ability for patients to return to clinics, and somewhat of a decreasing demand in our testing sites than we had previously seen. There's still a steady requirement for testing on any given day, but it's less than it was around the holidays. So overall, that's the status for St. Alphonsus.
Thank you, Dr. Bramwell.
Thanks, Lisa, and thank you, Board of Directors, for having us here. I'll start off by saying that right now it feels like spring weather, and I'll tell you what I mean by that. We're just finishing up sort of the third wave of COVID, and by spring weather, I mean 50 degrees in February feels fantastic. 50 degrees in October hurts you just a little bit. So our numbers have trended down over the last month, similar to Mark's, and we are now ranging in the 50s as far as the number of inpatients that we have with COVID currently. Back last July and August when we had 50, it was awful and difficult and challenging, but back to my spring weather analogy, 50 right now feels great compared to 150 and 170 that we were seeing in around Thanksgiving time. So right now, resources are in a good spot. We don't have any PPE issues to speak of. We have been slowly able to ramp up our ability to take care of elective surgeries again, and that's brand new as of really 2 weeks ago. So we're in a good spot right now, and the third wave seems to be definitively over.
Great, thank you, Gina. Can you talk about the community and how the community transmission is and what you're seeing?
Absolutely. Thank you, Lisa, and thank you, board, for your time. So we are also seeing cases decline. I think everyone is. That happened in about mid-December, they declined, and then there was a little bit of a peak towards the beginning of January, and then we've seen a steady decline since early January, which is nice to see. I can say that, we're all hopeful that this continues. The spring weather, we all like to see that, as Dr. Brahmo said, but where we're at now, seeing at case rate wise, it's around 24 per cases per 100,000, which is our biweekly case rate, and that still remains higher than we were, where we would be when we recommended schools reopen in the fall. So that case rate that we had established was 20. So it is encouraging, but we're still not where we would like to be as far as seeing those case rates be more declined and more stable across our county.
Thank you, Gina. This next question is specifically to you. Now that Governor Little has moved Idaho from stage 2 to stage 3, and with Ada County remaining in the red category, according to Central District Health, what effect, if any, does that have or should that have on our school operations?
Yeah, it's a really good question. I was trying to think back of the other stages, whether we move forward or backwards, and whether those had any impacts on the decisions that you all made or our recommendations. And I don't recall that to be true. That's really looking at the businesses and the economy and how do we get things opened up or shut down to control those case rates. So I think knowing that the community is opening up, I think, buckling down on your operations is probably highly recommended at this point. We are going to see group gathering sizes and just some other things to happen in the community where that could potentially cause our cases to increase. Now, if the community and people in general follow those mitigation measures, that might not be a true statement. We could slowly open up and continue to see cases decline. That would be everyone's, best case scenario, I think. So I don't know that there is a change in operations necessarily, because schools have been unique in the way that you've been a controlled environment. You've had that exception to the gathering size because you offer educational opportunities for youth. So I couldn't think of something that would make me change or make our health department change the way that we would recommend you operate based on the governor's orders.
Thank you. We would like for all of you to give us an update on how the vaccine rollout is going, and we'll start with Dr. Brahmo.
Thanks, Lisa. So I'll start off by saying that the demand for vaccines has been really gratifying and it's sometimes overwhelming. Particularly a week ago when stage 2.2 opened up, we had over 100,000 people log in to MyChart to try and schedule vaccines for themselves. And our system lost against that number of people trying to get vaccinated. But in broad terms, as of yesterday, we've administered over 36,000 vaccinations so far through St. Luke's. We are administering between 7,000 and 10,000 vaccines each week. And I will summarize it by saying when we get it or when we get them, we give them. We are opening up appointments each day or each week as we get our new allotment of vaccines from the state, and we ratchet up accordingly. On Saturday, 2 days ago, we gave over 2,500 vaccines in one day. This is largely because it's a very convenient day for civilians. They can deal with the somewhat expected side effects really easily on Saturday and Sunday, and it's a good day for a lot of our volunteer medical staff to be able to help out as well. So I would say, in summary, the vaccination effort is going exceptionally well. We went through the healthcare phase or healthcare worker phase relatively quickly. We then moved on to first responders and teachers. And I'm curious what the data suggest on teachers. So far, to my mind, they are the most eager, highest percentage of vaccine recipients so far. But I could be corrected on that. But so far, I would say that the vaccination efforts have gone quite well. As soon as we get vaccines, we try to give them that next week.
Great, thank you. And I would agree with you. I think that I'm pretty excited when they were able to get their vaccinations. Dr. Nasser.
Thank you. Yes, I would agree. Big picture overall, lots of interest, lots of demand, and we have been grateful to be able to mobilize our staff to give vaccinations initially to healthcare workers and then other teachers and first responders. What some of our challenges with the vaccination effort to date have been the predictability of the supply and the incoming vaccine, which has caused some ups and downs with scheduling and the need for shifting patients and getting them signed up and shifted, but that we're starting to be able to smooth that out. There's been a collaborative between all the hospital leaders and the clinic leaders in the community discussing vaccination supply and a sharing of a strategy to try to really meet the needs of the community. At St. Alphonsus, we're currently giving vaccinations at all of our hospitals, and we initiated vaccinations at several of our outpatient clinics as well. I think to date, we've given between 18 and 20,000 doses, and we have a 7-day-a-week operation where we're able to vaccinate to the max extent possible, whatever the supply we have on hand, to all who are eligible based on the state guidelines. And so we're closely following that and getting ready to outreach, to additional Idahoans who, as the next categories open up. So definitely a complex issue with some challenges, but big picture, very pleased to be able to have vaccinated so many folks to date. Thank you.
Thank you. Gina?
Sure. Well, I think they did a great job explaining some of the complexities of getting this rolled out, and the main barrier includes the demand versus the supply and what we get. And as a district for our 4 counties, we only have received about 55,000 vaccines so far in a district of 500,000 folks. So we're a long ways from getting the numbers that we need to get the population vaccinated, but based on all that we have available, including healthcare partners who are, nose to the grindstone, getting those vaccines administered, including our state partners getting the vaccine to us and working through that allotment. It's going, reasonably well. Of course, with the demand being outweighing that particular supply causes a bottleneck and lots of confusion and frustration, but we're working through it, and it gets better every time.
Thank you. I'm going to start next with Dr. Nasser. On this, I'm going to combine a couple questions. So, does it matter what brand of vaccine people receive? And are you concerned about any of the negative side effects from receiving the vaccine?
Yeah, thanks for that question. So to date here in Idaho, we are giving 2 vaccines that we've received through the state. They're both a very similar type of vaccine. The method that they work is an mRNA or messenger RNA, a type of a vaccine, and that would be the Pfizer and the Moderna. They both work in a very similar manner. They have a very similar safety profile and a similar side effect profile to your question about concerns for side effects. For the most part, for a vast majority of patients, the side effects have been what we would expect from a mounting immune response to the vaccine. So that might be some soreness or achiness or some mild cold or flu type symptoms, which are normally self-limited. Vast majority of patients who do get those side effects from the first dose or the second dose, they get them and they're what we call self-limited or self-resolving. They last perhaps a day. So there's a very small chance of an allergic reaction to any medicine that we take or any vaccine, and those few cases are similar between the vaccines as well. And that's why we observe patients after we give the vaccine to make sure there's no development of those types of symptoms, and we're able to treat them accordingly. So I would say that the side effect profile of these vaccines is very impressive. Very safe, and the efficacy or the effectiveness of the vaccines as far as preventing or providing protection or immunity for patients, especially for contracting a case of COVID or a serious case of COVID that would possibly land a patient in the hospital or into the intensive care unit. These vaccines are incredibly high effectiveness at protection for that sort of a case of coronavirus.
Dr. Brahmo, do you have anything to add to that?
Yeah, I would say that our rate of vaccine significant side effects is similar between the Moderna and the Pfizer so far. And we're tracking this really closely, both through applications on people's phones, as well as watching people for 15 minutes after they've received the vaccine. The rate of significant side effects is about 0.22%. So we've had just under 50 of these events in about 27,000 vaccines where we have these data. That we know of, no one's needed to be admitted to the hospital thus far with the vaccines we've given. And I would say that there are not any compelling data one way or the other between the Moderna and the Pfizer vaccines so far. They have slightly different freezer requirements, and they have slightly different spacing requirements between the first and the second dose, but they seem to be largely equivalent.
Gina, was there anything you'd like to add? Okay, I'm going to ask that. I'll start with you then, the next one, Gina. What have you heard about children and vaccines, and when do you anticipate children will be able to receive the vaccine? Dr. Brahmo, did you want to answer that?
Yeah, could I start with that just to provide some framework? So the Pfizer vaccine currently has been authorized under EUA for patients who are 16 years of age and older. The Moderna similarly is for patients who are 18 years of age and older. Pfizer has reportedly just finished a study with 12 to 15-year-olds in the last month. We don't yet have any data there. Moderna is also studying their vaccines in 12 to 17-year-olds. They have 4 locations where they are actively enrolling patients in the country. One of them is this small town called Meridian, Idaho, where I think they just picked a place with a lot of kids. And so we're fortunate in that way. That's something where patients are actively being enrolled. We've had a few patients successfully participate in that so far. The challenge that we have right now is children, particularly younger children, not just the adolescents, but the younger children frequently are the last group or one of the last groups to get studied. So most likely, or ideally, we'll have some vaccines that we can start using in older teens towards the end of this calendar year, but it may not be till 2022. So there's a lot we don't yet know about these timing and these releases.
Thank you. Gina, did you want to add anything before Dr. Nasser?
I actually learned something from Dr. Bramwell. I mean, I think it's emerging and we try to keep up with it, but the answer is we just don't have a particular timeline for when we think this will be available. We do know that kids are a very precious population, and so they don't take those studies lightly. And there's lots of rigorousness that goes throughout to make sure that it is safe and effective. So we've kind of heard nationally that it could be towards the end of the year. And that one might be for the older population in that youth group, but again, we don't really have any concrete information yet.
Thank you. Dr. Nasser?
I would just add to continue the thread that, children and then normally pregnant females are the studies normally take longer in those groups. And so we would expect the same with this vaccine and that because they're actively underway, we look forward to hearing the results for the extension of these vaccines for safety and effectiveness into the teenage population and then perhaps younger.
Thank you. Dr. Nasser, I'm going to start with you. Just the question, I know that a lot of people have been asking this. Can you be a carrier of COVID-19 if you've been vaccinated?
Yeah, this is a really interesting question that almost from the first few days of getting the vaccine available, we've been discussing it here amongst our the healthcare professionals. What we do know and what we understand because of the research on the vaccine is that those who are vaccinated have protection and immunity against the coronavirus, specifically against the virus that was studied. And I think there might be some questions on the new variants of the virus, but good protection and good immunity against developing a significant or a severe case of coronavirus, and a very high protection rate there. What the question on hand that this refers to is it possible to get a very low level infection of coronavirus or even be asymptomatic? That means you're carrying the virus, but you're displaying no symptoms. And we know that this has been one of the biggest challenges of coronavirus is the fact that there's a wide variety of symptoms amongst patients. Some get very sick and some have such very mild symptoms or no symptoms at all. And then we find out later that they were actually positive for the virus and were able to share it with others. And so that's the question at hand. Is it possible to have a low level of the virus and perhaps even past that, even though you've been vaccinated? That's actively being looked at and studied, and we look forward to hearing more on that. One would conclude that it would be difficult to have any significant amount of viral load and be sharing that if you've been vaccinated. So it would be reasonable to assume that it would be a much lower level of chance to have the virus and spread it. But definitively answering that is what's actively being looked at present.
Thank you, Dr. Brahmo.
What I'll add is if I get vaccinated, which fortunately I have, but if I get vaccinated, what we know is my chance of a significant COVID illness drops 95% of what it was. So I have a 5% chance of having a severe illness. What we don't know is, can I carry the disease? Can I spread the disease to others? That's being studied, as Mark mentioned, but I don't think we have a definitive answer for that yet. We know that the virus protects me from getting a severe illness, but we don't know that it prevents me from spreading it, not yet.
Okay, thank you. I'm going to start with you on this question. It's kind of a long question. Given the prevalence and positivity rates when our district moved from all remote learning to hybrid this fall, how did the relative risk faced by teachers then compare to the relative risk faced by teachers today who've had 1 dose of the vaccine and similarly when they've had 2 doses?
Lisa, was that for me? I'm sorry, I missed that.
Yes, I'll start with you.
Oh, that's kind of a challenging question to answer. I think that, the effectiveness of those vaccines, both Moderna and Pfizer, were based on 2 doses, period. And so there is some data out there saying that there was some effectiveness at 92% for Moderna, for example, after the first dose. But what we don't know is how long that immunity lasts. There was no study of those participants past 28 days. So there really isn't anything to tell us that there's any long-term benefit from the single dose. And we frankly won't know that. It's currently being studied, I imagine, along with an aggregate of studies from all the questions that people continue to ask about the scenarios that they encounter. But in general, certainly the risk is lower if you have some level of immunity based on the vaccine than if having no immunity when we open back up or when we return and there was no vaccine within the teacher population. So I don't know the exact relative risks, I think is the question, but there is some increased protection that those teachers and school staff do have as a result of that single dose, but the length of that is unknown at this time.
Dr. Nasser?
I would just add to Gina's comments, which are spot on, that the studies and what we understand are really based on the initial dose and then the booster dose, which introduces the protein so that your body can make antibodies. And then by reintroducing it, it allows you to build your defenses up such that you have that 95% protection, and 95% protection against severe illness. And so there's probably some amount of immunity you get by 1 dose, but with the 2 doses, that's what we understand that would give you the longer lasting immunity. And as the new types of vaccines and new brands of vaccines come out, more are being studied right now. Some of them work in different mechanisms and they have different effectiveness rates. We'll see and understand more, but for the 2 that we have now, that's exactly correct how they work.
Dr. Brahmo?
Yeah, nothing really to add here other than most of the information that we have for these first 2 mRNA vaccines are after the 2 doses and how effective those are at preventing significant disease.
Okay, I'm going to start with you on this one, Dr. Bramwell. So this is about the new variants of COVID-19. What can you tell us about those and the effectiveness of the current vaccines against new variants? And are there additional precautions that our schools should be taking because of these variants?
Sure. This is top of mind for lots of people, I think, with the sort of invasion of variants, as it were. There are a number of different variants in South Africa and UK and a few others. You know, the main thing that seems to be coming out so far with these new variants is that they are better at spreading themselves. They are more contagious. They are able to go from person to person at a rate that's higher than the prior virus subtypes. So far, these variants don't appear to be more devastating to individual patients. In other words, the UK variant is very effective at, maybe it's 50% more effective at jumping from person to person, but it doesn't seem to cause a higher ICU rate, a higher ventilator need rate, a higher mortality rate. So it's so far, these other variants seem to be about 50% more effective at being transmitted from person to person, but not more deadly, shall we say. I think that what this causes me to do as I think about these variants is I think we need to buckle up a bit. I think we need to be worried that that this may not be the time to change our preventive measures or to relax our preventive measures, because if these variants aren't here already, they'll probably be here in the next few weeks. And since these viruses are more efficient at interpersonal transfer, I think we need to maintain our precautions and our preventive measures as best we can.
Thank you, Dr. Nasser.
I would agree that this is a good time to be very cautious as we start to understand these virus mutations or variations more. I would also just add that this is what viruses try to do to survive. They will change and mutate and vary in order to make their way through a population. So we see this with other viruses. It's not wholly unexpected to see this with the coronavirus. But with a variation or a mutation that could cause increased transmissibility and move through the population, we'll need to, be cautious to try to limit and prevent that, to ensure that it doesn't increase significantly the number of cases all at once, and that would be the concern and the second order effect of that on those patients.
Thank you. Tina, I'm going to start with you on this next question because I do think that you have a unique picture of all the different entities and community spread. So do you believe we could reduce community spread by having children in schools instead of daycare or those educational pods that a lot of families are using?
I'm going to approach this very carefully because I think the answer could vary. Any environment can be created to reduce community spread. I'll just make that statement, whether that's a business, a hospital, a school, with those prevention measures in place. So this will vary by school, it will vary by community. I think for those families that have to shift their young one around from care to care, if that's consistent structure from a school setting where mitigation measures can be enforced versus at another place in in-home care where there is no social distancing and those types of things, I think the answer would be yes. For those schools where they're not enforcing that, they don't have masking, they don't have social distancing, I think that that's not really an answer I can give, that it's safer to be in schools. But for those schools, which we have been very proud of the way that many schools have shown up and made significant modifications to the way they operate. In fact, I think if we asked you, 2 years ago, if this would be happening and you would, meet that bar, I don't think anyone would believe you could, the similar way that a lot of us felt like we couldn't change our lives the way we have so dramatically. So it is a yes and no answer to your question. I think that structure and enforcement and having that trusted adult to share information about spread and about how to take care of yourself is critically important. But it is going to depend on the ability for a school to operate those plans as they're laid out.
Thank you, Dr. Nasser. Do you have anything to add?
I would just add that really the safety measures that have been considered and implemented across the school have been, I think the attempt has been to follow those closely, and they have been effective as far as our best understanding at watching the numbers to prevent any sort of sustained significant movement or spread through the school. It's hard to make the statement that bringing people together will reduce community spread. And I think that's what Gina was trying to refer to. But any hospital, any school, any place of work that implements, those measures is going to mitigate that risk in the same way that the Boise School District has implemented them to mitigate risk.
Dr. Brahmo, anything to add?
No, Lisa, nothing to add here.
Okay. All right. So as you know, we have an exploratory committee that's looking at conditions for when and how we can return to 5-day-a-week in-person learning. It'll be up to the district's administration to consider information from the exploratory committee in making recommendations then to our school board. This next set of questions will kind of revolve around that theme. And Gina, I'm going to start with you. This question would be specific, I think, to your experience with Central District Health. Are you seeing COVID spread in districts with students who are back in school 5 days a week? Are you seeing it spread more perhaps than you would see in a hybrid situation?
Sure. I asked my team about this particular question because I didn't feel comfortable. Yes, we can see more spread in those particular groups that have our particular schools or classrooms that have the 5-day-in-a-week. But what we do see is a significant amount of more quarantines because there are more students exposed to a positive case. And so those schools do see a larger disruption in the way they have to, learn and teach, because if they have all students in the classroom and there is a couple, one student that's infectious or the community spread is very high and there's multiple kids infectious in a classroom, then it puts those close contact numbers higher than if they were in hybrid, where you would maybe have one or two or just a handful or a small pod that gets quarantined. So it also varies, again, by the structure of those individual schools and the classrooms and the way that they enforce the operational plans. So it isn't a yes, no, we see more here and less here, but it really is dependent on the way that things are laid out, the way that people enforce and follow through and families follow through on the weekends or the evenings. And it goes back to more quarantines. So in a sense, more potential exposures to turn into cases, but not all of those turn into community spread, of course, because they will have masks on and they will have other mitigation measures in place.
Thank you. So that was a nice segue about this quarantine question. Currently, we quarantine anyone in Boise School District who has been within 6 feet for 15 minutes of someone with COVID-19. And we use the 14-day exposure quarantine guidance. Can you give us your experiences in the hospitals with how you quarantine and your opinion on the length of quarantine time we're using? What are other school districts doing in terms of quarantine? And under what conditions could we possibly use either 7-day or 14-day quarantines? That's a really big question. We'll start with Dr. Brahmo.
Thank you. This is a hard one, as are many of these, but so far, for the majority of the last year, the CDC has recommended 14-day quarantine after a significant exposure. And the definitions vary somewhat, 6 feet for 30 minutes or 6 feet for 15 minutes. But once you hit threshold for a significant exposure, it's recommended that you quarantine for 14 days. There's been some recent discussion at the level of the CDC that maybe 10 days is enough after a significant exposure. And the number of patients who will demonstrate symptoms after 10 days versus after 14 days is minimal. I want to say it's in the range of 2 to 3%. So 10 days, about a month ago, was recommended by the CDC as one option to consider rather than a 14-day strict rule. We talked about that within our St. Luke's committees, largely in the one I get to participate in called Medical Operations Committee, or MedOps. And we meet every Monday, and we talked about that particular issue. And we felt like we did not want to change our policy yet. We are willing to change it in the future, but we really thought, and this was probably 2 weeks ago that we had this discussion in some detail, that right now was not yet the time to shorten our quarantine phase for our staff, largely because of the influx of the more contagious variants that we talked about a few minutes ago. So we thought that while it may be somewhat low yield, we weren't ready to shorten that just yet. We wanted to see how things settled out over the next 6 to 8 weeks, and then we'd revisit that. One of the strange things I'll share with you, being in a lot of these discussions within our system, is a lot of these topics come up over and over, and we revisit them with more data, with increased case prevalence, with new changes, with the variants. So there's a lot of this that we are evaluating nearly constantly, and this is certainly one of those areas.
Thank you, Dr. Nasser.
I would say very similar to Dr. Bramwell's comments. I would add that we've been holding to the CDC guidelines and continuing to look at the data. The other thing from a hospital standpoint is we've really tried to be very strict about implementing masking and distance between hospital colleagues and just minimizing that space when patients enter the hospital or the clinics. So by holding to that, we're really reducing the number of what we would call a significant exposure. So when you're keeping your distance and the masks are being worn and the 15 minutes is bad, there's less and less situations where that's the case. Folks are in close contact, face to face or head to head, and no masks, beyond 15 minutes. And so it's those situations from a hospital standpoint that we're trying to address and mitigate. Sometimes it would pop up in the lunchroom, or sometimes it would pop up in other areas, similar to the schools as you're tried to look at the situations, whether they're the bus ride or sports or the lunchroom, to try to reduce the total number of what we would call a significant exposure, where later you find out one of the students or staff members came positive, and then it reduces the number of folks that were in close contact. So that's the tactic we've taken, and then continuously looking at the data and holding to the CDC recommendations.
Thank you, Gina.
Thank you. So we also recommend the 14-day at this point in time as our best practice recommendation, because that is the period of time in which someone can completely be infectious. There is evidence to show that the level or the percent of people who do remain infectious at the latter part of that quarantine period is minimal, that 2 to 5%. I'm not sure what it is exactly. So I think the second part of the question is, what are we seeing other districts doing? Do we see other districts using the 10-day or the 7-day? So there, for the most part, many of them are using the 14-day to continue with that because it feels the safest, and it is the safest, and it's what the CDC is recommending. We do have a couple that are, toying with the idea or slowly implementing the 10-day. We don't really recommend the 7-day because that is something that has to require a test, a negative test, to be able to return after day 7, and not all families have access to be able to receive that test. So to be equitable, we use the range of 10 to 14, 14 being the best case scenario. I'll take a moment to talk about, and I think that your board of trustees are probably aware, is the Department of Health and Welfare came out with some recommendations that if both parties were masked, that individuals didn't need to quarantine in a school setting. So this was new information for us to receive, and there's no evidence at this point to support that if someone is masked that they're not therefore exposed and could not transmit. And some schools have looked at this and felt that they wanted to take this particular route, and have quickly found how challenging it can be because the exception is geared towards allowing in-person instruction. So that exception to quarantine for someone who has been exposed allows for in-person learning only. So it's in the classroom when learning. They still need to quarantine at home. They still need to quarantine before and after school. They should not be going to the lunchroom as a potential exposed person who could then remove their mask with a bunch of students. They should not be participating in after-school activities. People should not be visiting their homes. It gets really complex really fast. It does have that allowance to continue the in-person education piece. And it is out there. And we, despite that, still feel in accordance with the CDC that the 14 days is best practice at this time. I think we all hope that it can change, that we can recommend something shorter. And part of the reason for that is to help increase compliance with that 14 days, because it's quite a long time to not be able to do the things that you want to do, especially if you're a family who needs to go to work and doesn't have the opportunity to do that remotely. So we see a variety of schools implemented different of the different spectrums of the 0 to 14 days, but the majority of them continue with the 2 weeks at this time.
Thank you. I'm going to combine a couple questions here. So what does research tell us about the transmission of COVID-19 health risks in kids, transmission and health risks in kids? And then what would you think, if you could explain the relative increase in risk faced by students attending 2 days versus a 5-day schedule that we're looking at considerations for. And I will start with Gina.
I'm going to leave the first part of that question to Dr. Nasser and Dr. Bramwell, but I can address the second piece. So when you look at potential exposures, you're looking at time spent exposed to a potential infectious case. And so when you are in class, I'm going to say an average of 6 hours per day for 2 days, that's 12 hours compared to the 6 hours for 5 days of 30 hours. The percent of increase of time spent with others, potentially not social distanced, if you're 5 days a week, just increases your risk of being exposed and getting COVID. So there is the question of, would they be going to a daycare in those alternative days and then being exposed to a second set of folks or kiddos or staff members on the days that they're not in school, which was part of the original question that I answered earlier about, is it safer? Sorry about that. I think that one of the things that I want to recognize is that the number of hours spent total in school, whether that's in person or whether it is in school sports, et cetera, is going to decrease on the fewer number of days that you have.
Dr. Bramwell.
Yeah, just trying to figure out whose dog that is. I'm looking on the screen, seeing who's panicking. So I agree with the way Gina outlined it. If you are in school for 2.5 times the number of hours with a 5-day versus a 2-day thing, it certainly sounds like your risk would go up. A lot of that also depends on how do things change in the 5-day classroom versus the 2-day classroom. If it's a 5-day, are you still able to distance? Are you still able to mask? My hope would certainly be yes, but if those things change, then the risk goes up further, not just because of the amount of time, but because of the type of exposure that you could be having. The other things I wanted to share with you about children and COVID, just a couple of statistics to bear in mind. Children are between, and it's sadly defined differently in lots of different studies. Sometimes they pick age 14, sometimes they pick age 18. When they defined MISC, I think they went up to age 21, which outside of alcohol rules, most people don't describe a 19-year-old as a child anymore. But the number of people who are children is about 20%. I think in Idaho, it's 23% defined that way. Of all the tests that pop positive for COVID, that's about 10% of them. So 90% of the cases are happening in adults and only 10% in children. As far as people who get admitted to the hospital, children represent about 1% of all of the admissions to the hospitals for COVID. And as far as fatalities are concerned, they are about 0.1% of all the fatalities. So 99.9% of the fatalities are in adults and only 0.1% are in children. So some people will equate that to mean, or will take that to mean, well, children don't get this at all and they don't have any problems with it at all. If the only thing we are looking at is fatality, which I'm afraid some people do, then that's correct. But what we don't know yet is how this affects children long-term, or how this affects how effective they are at transmitting to their parents or their grandparents. So those are some basic statistics about sort of the immediate problems with COVID with children.
Thank you, Dr. Nasser.
Thank you. Nothing further to add on that.
I'm going to shift down a question, and I'll come back up to a previous one. So your thoughts on the language used, the CDC indicator and thresholds table document for mitigation strategies states that social distancing should be used to the largest extent possible. This matches up with our interest also to respect CDC guidelines the best we can. The CDC standard is 6 feet. The American Academy of Pediatrics states a minimum of 3 feet between desks, but ideally 6 feet. What is the minimum number of feet we need to distance in a classroom before we consider grouping students or podding, POD pods students? Can you discuss the risks associated with 6 foot social distancing versus 3 or 4 foot social distancing? And we'll start with you, Dr. Nasser.
Thanks, Lisa. So the 6 foot recommendation comes, to my best understanding, based on a continuum of risk. So 6 feet is going to be safer or less risk than 3 to 4 feet. 6 is not going to be as safe as 10 feet, and 10 feet is not going to be as safe as 20 feet because it all has to do with mitigating the risk of respiratory droplet or airborne, the ability to transmit. And then, of course, the face coverings allow basically providing the equivalence of distance by helping to mitigate risk as well. So I think that when you try to implement a public health measure, such as keeping distance, you have to come up with something that's workable. And to our best knowledge, the 6 feet really reduces the risks down to a much lower level. I'm not aware of the data at 3 feet versus 6, but intuitively that it would introduce more risk to be closer. And so I think that would be the fundamental question if you're going to try to reduce the distancing between students as we consider bringing either more students into the same room or sharing time and space together, versus, trying to continue folks at a distance that the school has been doing in the current model by alternating on days or alternating on times. So
Thank you.
it's all about a curve of risk. So thank you.
No, sorry, I didn't. Was there anything else there? I apologize. Okay, Dr. Bramwell.
Yeah, thank you. This is a really hard question. And to Mark's point a minute ago, I haven't really seen data that say that your risk doubles or your risk quadruples or your risk is, I haven't seen a number that gives us a handle on how the risk is different between 3 feet and 6 feet. I think we feel like 6 feet is the gold standard and is what we're aiming to have in all of our situations, and that 3 feet in some scenarios is adequate. I'm not trying to evade answering this question, but there aren't particularly good data points to point to. I wish that there were, and that's why you're seeing different recommendations from different bodies. Is, people feel like 3 feet is good and 6 feet is better, and that's about as strong as you can probably come down on that distinction.
Thank you, Gina. Do you have something you'd like to add?
Yeah, it all comes back to the exposure risk, which is with anyone within 6 feet. So for a school district or a school or classroom to look at how they want to operate, there's no magic number, right? It's just those within 6 feet. If you're in a pod and the 4 of you are all together at 4 desks pushed together, versus if you have 4 kids in separate corners, one person is infected while at school or infectious while at school, then in the pod, all of them would go home, whether they were 1 foot, 2 foot, or 5 feet. If they're not further than 6 feet, then they're going to be considered exposed and expected and asked to quarantine to stop transmission. So I don't know that there is that, we know the AAP comes out with recommendations of 3 feet, and part of that is just the value of in-person learning, and the risk is additional exposures as a result of that in the classroom. And when community transmission is low and low enough where you only have a few, if any, positive cases in your school, then that makes sense. But when community transmission remains high, it's much different to have one infected kid in the classroom versus it is to have 6 infected kids in the classroom. And so that is, something we absolutely support in moving forward. And I guess when we look at our case rates, we're just not quite at the place where we feel like that might be appropriate for the safest risk reduction possible.
Thank you. I'm going to start with you on this one, Gina. So how does the vaccine rollout affect our consideration of return to full-time in-person learning? We've also heard that reopening of schools, one of the considerations is the vaccinations of the 65 and older population. Can you explain that?
Yeah, I would be happy to. Thank you. It's a great question. So Central District Health has coached and carried the community through this pandemic. And our main 2 goals throughout this entire thing has been to protect our vulnerable population, which are those with severe health risks that put them at jeopardy, as well as the 65 and older population. And our second goal is to not overwhelm the hospital, ideally by protecting the vulnerable population. And so from where we're standing, having the opportunity for the 65 and older to receive both doses of their vaccine seems like a condition that is very appropriate for more opening up of our community in general, including bringing schools back to more kids in person. It's critically important that those folks are protected. We know we have multi-generational families. We know we have students that go home and stay with, aunts and uncles and grandmas and grandpas while families are trying to figure this out. And so we know that there's a timeline. It's unknown at this time. It's a multi-week process. I heard 9 weeks the other day about how this will look depending on the vaccine allocation that we get to our state. I think we would all wish that we could just get, planes dumped on us of vaccines and get it administered as quick as possible. I have no doubt our healthcare partners would figure out how to make it happen. But with the trajectory of the allotment that we continue to get weekly, 6,000 to 7,000 doses a week, we anticipate it to be spring. I know that spring break is a nice cutoff for schools to look at switching operational modes, but we feel it's really important that risk, the highest risk population, is able to receive a vaccine that will help protect them from severe disease of COVID, whether they get it in the community from or from a family member or group gathering, et cetera. They have the opportunity to have that level of protection should they choose to.
Thank you, Dr. Nasser.
Thank you. Dr. Brahmo and I learned today that from one of our physician leader colleagues in the community that the CDC is, we know that CDC is continuously reassessing recommendations on safe return to school. I would just echo, I think we've shared in previous board meetings that it's generally felt and completely agreed upon that the best scenario for our children is to get them back into the school learning environment as soon as we can safely accomplish that for a whole variety of reasons. We think we agree from a medical community that that's very important. And so there's definite eagerness to try to move in that direction. To date, it's been a series of things that the CDC has recommended to consider, all the different factors that go into this decision. And we discuss this regularly when we huddle with the BSD leadership, but hospital capacity, rate of transmission in the schools, rate of positivity and testing, all the mitigating factors that are implemented operationally at the school. So all of those kind of go in to help us make the decision. And I think we just need to continue to look at that. Continue to be seeking, the guidance that CDC is going to be putting out now that the vaccinations are rolling out. That's going to be another factor point in addition to everything we've discussed that will help us to comfortably move forward in advancing our education in that direction. But as far as the exact date and timing of that, it's complicated by everything we've talked about and complicated by the questions on the new strains. And so I think we just have to very deliberately and cautiously walk forward and continue the conversation and keep looking at the data together.
Thank you, Dr. Brahmo.
Nothing to add. I think Gina and Mark summed it up really nicely.
So I'm going to start with you on this one then, Dr. Brahmo, and it's a tough question. How would you weigh mental health concerns of students and families versus physical health concerns for the community?
Yeah, that's a great question and a really hard one to answer, like many of these. The challenge that I think I drew attention to a few questions ago is that the immediate effect on children is quite low as far as getting COVID and dying. We have very few cases of patients needing to be admitted. I believe we're up to about 55 in the state in the last 10 months or so. I don't believe we've had any fatalities. So the physical effects on children in the short term are quite low or quite unusual. The mental health concerns are very real. And I don't know that we have an answer to the extent of those mental health concerns yet. I think we are all, adults and children, really tired of this. I was teasing one of my colleagues today that I don't really see people anymore. I just see 1 by 2 inch photos of people anymore. And that takes a toll on all of us if we are remotely working or even in an office, but with the door closed and only on computer screens. I think the challenge on our mental health for our children is very real. Sadly, I need to share that we've had more admissions to our hospital for mental health reasons of severe anxiety and depression and acting out on those issues than we have in prior years. So it is affecting our kids and it is difficult for all of us. And I don't think we have a firm handle on how extensive these problems are going to be long term, but it is clearly taking its toll on all of us.
Thank you. Dr. Nasser.
I think Dr. Brahmo summed it up really well. And I would add that it's really important to try to safely, as parents, as staff and leaders in the school and board members, but as our students, to try to encourage them to figure out how to safely connect with one another, to get outside and to address the fact that the pandemic and all that the way it's impacted us in our community has taken a toll on our physical and our mental health. And so I think addressing it, talking about it, and trying to connect and encourage in a safe manner is really hopefully the way we can go as we're trying to continue to move forward and recover through the pandemic as a community.
Thank you. Gina, do you have anything to add?
Yeah, they did a great job summarizing just the complexity of all of this. I think there's costs no matter what decision you make, there's someone that's impacted more than somebody else. And I'll tell you that from where we're sitting, we don't believe that schools are responsible for managing the disease burden in our community. That's not your intent or your objective. You're just so critical and integral to the community that I don't know a way that you can't be a part of it, at least play a role in helping manage the community through this. We are also very well aware of the mental health and social and emotional challenges that are faced not only by our youth, but by families, parents, grandparents, et cetera. So there will definitely be some long-term impacts. And again, what those end up being, we're not sure. And I don't think that there's a scale that can weigh the mental health impacts that are happening at this point in time.
Yes, I agree. Thank you. We've got two of our prepared questions left. What conditions do you feel are necessary before we return to 5-day-a-week in-person learning? I know you've all been very supportive of our hybrid schedule. For example, when teachers are fully vaccinated, and if we were in a category yellow, would that change how you feel about shifting to 5 days a week? And I will start with you, Dr. Nasser.
Thank you. I think the conditions are going to be really what we've been discussing as a team with BSD leadership, all the different data points that the exploratory team is looking at, that's exploring the possibility of different options to return. I think BSD has really done a great job at trying to consider all the key stakeholders, the faculty and staff, the students, the parents, and get all that input as well. I referenced earlier that the CDC has published different factors to consider, everything from disease burden in the community, transmission, hospital status, and now vaccination would be added to that. And so I think as we're trying to make that decision to move from 2-day to 5-day, it was touched on earlier in this talk that the operational application of all those risk mitigating factors that the schools implemented needs to be a factor to consider as well, because that's another key factor at continuing to have the safe environment where we would hopefully not see significant or sustained spread in a school environment. So thinking through, as the board thinks through the return, those would be the factors I would consider.
Dr. Brahmo?
Yeah, I think Mark did a really nice job there. I would add that what we did back in November parallels the way that I still think about this. Back in November, I think we saw that there was an uptick in local cases at schools. We saw that there was an uptick and there was starting to be a problem in our hospital capacity. And we made a decision at that point to change into fully remote for a period of time. So to Gina's point earlier, that their goal within Central District Health was to keep the community as safe as possible and keep the hospitals most able to care for people. I think if we keep those two goals in mind, you would probably settle on the rate of community spread per 100,000. You would look at how that is changing over time. Are we on an upswing or a downswing? And you would look at the sort of the number of positive tests, and a lot of these criteria are outlined in a nice chart by the CDC. As Mark mentioned, it's entirely possible that the CDC is crafting something new that I'm told will be clearer, which would be outstanding. I think the prior document is good, but maybe they have something that's coming, hopefully this week, that's better.
Great, thank you, Gina.
Yeah, the only thing I would add is the conditions we're bringing more students back in. Again, it comes back to that exposure and that the ability to contact trace. So right now, you're looking at double the number of people quarantined at a minimum. And so making sure those families are aware, contacted, they're monitored, they're following the protocols. That's an internal condition. And then the ones that were already mentioned with the community spread being a little lower will make your job easier. The vaccinations are going to be critically important for not only teachers, but for that 65 and older. I think that that's something that we would want to consider for our conditions. And then I think masking, we haven't talked about it. Your students and staff have done an amazing job, but to continue that as a condition throughout this school year, possibly next, we won't talk about next year, but at least for this particular school year, that's going to be critically important to maintain the risk and keep it as low as possible.
Thank you. And I said I had 2 questions left in the last question, but now I have 2 questions left. Our childcare providers have mostly been open during the pandemic, oftentimes in classrooms that are much smaller than our school classrooms. Many of them are also serving our youngest children during their virtual days. How is the risk different for the childcare providers than our K-2 grade classrooms? We'll start with Dr. Brahmo.
There have been a lot of data points that have been collected and a lot of papers that have been written about the very young children and why is it that we're not really seeing large outbreaks in daycare locations. The only thing that I've seen written and described was just that small children aren't able to cough as effectively and as forcefully as older children and as adults. I've seen studies that show that the young children have just as much virus, sometimes more virus in their nose and upper airway when they are sick, but interestingly, they don't seem to spread it quite as effectively. And I don't know that we have a good explanation of that so far. I happen to know that there are some breakouts that happen in daycare facilities, but I don't have a great answer as to why the rate of those breakouts seems to be lower with the slightly different scenarios, like the 1-year-olds aren't wearing masks as an example.
Thank you, Dr. Nasser.
Thank you. Nothing further on that. I agree with Dr. Bramwell.
Okay. Gina, do you have anything to add?
No, he didn't.
And the last question is for Gina. And CUNA School District and West Ada School District have had students in grades K-5 in school, full-time in person, and both school districts are also in Ada County. Can you help us understand why CDH has continued to recommend hybrid learning for our district?
Yeah, it's a really good question. Our recommendation has been the same for those two districts as well. So you're not unique. Our recommendation for when in red or in yellow has been hybrid for the reasons we spoke about, the risk of exposure, the challenges with contact tracing, not only when you bring more students back into the classroom, is it hard to manage, but those communal areas where you then had 50% of your class in the cafeteria, you now have 100% of your classes in the cafeteria. The before and after school, those were incredibly challenging for these districts to manage and to be clear about who was possibly exposed and who wasn't. So your district chose to follow along more closely with the recommendations that we gave based on the level of community transmission. Again, there are costs regardless to either side of that. But I want the board to know that the recommendation wasn't specific to Boise schools. It was for any school district at this in our counties.
Great, thank you. So that completes the prepared questions we had. I'm going to turn over to our board president, Wagers, to see if he wants to facilitate any additional questions from the board.
Thank you, Lisa, and thank you, panelists. Trustees, you've had a lot of time to listen, and we appreciate the answers and the candor of the panelists. Are there any questions directly from trustees? Well, I've got one. So actually, I've got a couple. So I need to know, and I don't think we fully got to this. I like kind of a black and white answer from each of you. Do you think students should be back in 5-day-a-week school? And I think I know your answers, given our current conditions. And also, would that opinion change based on age bands within schools? So as the world sits today, if you were on the school board, would kids be in 5-day-a-week school? And then also, would you feel better about it if we had like K through 5-day-a-week, or would that answer still be the same?
This is
So let's see. I guess I get a play. Gina, you can go first.
Yeah, I'm happy to take that question. Thank you, President Wagers. Given that our case rates continue to be higher than when we recommended remote learning at the beginning of school, my thought is that we are headed in the right direction, but to the decision for the board today to start tomorrow, I know not that quickly, but would not be to bring all students back. I think to create a plan to have them start coming back, maybe more slowly in some type of staggered approach, whether that be after spring break, what's more reasonable for operations. We'd like to see a continued decline, a continued decrease in those case rates, because it ultimately makes it harder for your school staff to operate when cases are so high. And they remain very, very high. And it was very interesting that there was a previous question that referenced the CDC indicators and thresholds table document. And I actually went and looked that up. I hadn't referenced it in quite some time, and it was talking about the distancing. And the way they calculate case rates is different than us. We do a 2-week day average, and they look at number of new cases per 100,000 in 14 days. And their cutoff is over 200 for their recommendation for remote learning, or when the risk is the highest. So that greater than 200 is where they look at that. And we are currently in Ada County at 338, according to the way they calculate it. So we're certainly not where we would like to be, but we are, again, heading in the right direction. And to answer your second question, I do think there is some additional considerations for that K through 5 group to come back possibly sooner than the other groups. We see a lot more peer-to-peer transmission with the middle school and high schoolers than we do with the pre-K through 5. And they are the ones that tend to be shifted around in the care settings. They also have the more challenge doing remote learning and trying to balance, a quality education. So I think that it is wise to continue to look at that as sort of a target in a staggered, sort of a slow and steady approach as we open up and as we close up, button up, how you can make that happen safely.
Thank you, Gina. Dr. Nasser?
Thank you, President Wiggers. I think at this point, I would make the recommendation to continue in the current mode that the school district has continued in, which gives the maximal flexibility for the hybrid learning, for the online learning, for those families and parents that are seeking that. I would watch closely the CDC recommendations and all the different data points that we've mentioned in this talk that Gina's mentioned, and make a flexible plan that could be implemented in coming weeks, and also could be adjusted. To not make a decision now that's set in stone for perhaps 2 months from now, because it might be very difficult to know exactly what the current status will be then, but to make tentative plans that can be implemented. And I do believe that just like we scaled up and scaled down with the youngest of students returning sooner, and the data that BSD has been collecting would suggest a lower risk in that category as well. Not zero, we've talked a little bit about that here, but that would be a thoughtful way to scale back up, to use your age and grade considerations that you mentioned. Thank you.
Thank you. Dr. Brahmo?
Thank you, President. I would, back to your black and white thing, my answer would be, should we change now? I would say no. And I would support what both Gina and Mark have said, where I think that we're doing a great job. Cases are down, we're headed in the right direction, and we're not sure what's going to happen over the next month. I think it's very reasonable to make a plan to look at possibly shifting out of remote learning, say at spring break, because it's a sort of a logical point, and by then you can expand out of doors and you can do lots of clever things with space that you can't necessarily do in wintertime. And then your other question, I would also be supportive of a differential approach to I call lots of people patients, children, school children, to a differential approach to school children of different ages. That was, in all sincerity, one of the very clever things that I think your team did in the summer and fall last year, was a gradual approach to bringing kids fully into school 5 days a week, or hybrid in some locations. So I think the idea of doing that again, or at least considering that again, is a clever idea.
Thank you. Any other trustees? Questions?
President Wagers?
Yes, is that Trustee Oppenheimer?
Yeah. Thank you. I appreciate the three of you being here and answering our questions. I want to go back to the very.
You're a little quiet to us. If you could speak.
Oh, I'm sorry. Am I too quiet? Can you hear me now? I want to go back to one of the first questions around vaccines and how distribution is happening. Are you able to collect any data on who you're having to turn away? Meaning, my question is, are you having to turn away teachers who are wanting to get a vaccine but are unable to get
it? Beth was asking if you're having to turn away people. Have you had to turn away teachers so far? Has that been a major group that you've had issues with? I know once the 65 and older hit, we've had some concerns there, but I think previously we were able to get most vaccines, but we'd like commentary on that as well. So we'll start with Dr. Nasser.
Thank you, Trustee Oppenheimer, for the question. To my best knowledge, we have not turned away those in the eligible group. So healthcare providers, first responders, now teachers. What we have had to do is cancel and reschedule some number of patients that we booked because the vaccine supply did not arrive when we expected it to. And that has been a logistical challenge that we've been working actually collaboratively between the two hospital systems and with the other clinics in town. But for for each next approved category, we've been able, to my best understanding, for those who desire the vaccine, have raised their hand and said, I'd like to come be vaccinated. We've been, as a community, been able to accommodate them. And if there are exceptions to that, we would be eager to try to get those folks in, to try to help them, the teachers and the school staff being of a higher priority in this current stage.
Dr. Bramwell, do you have a follow-up on that?
Yeah, I have not heard of anybody being turned away thus far. It certainly is possible that people, or it has happened, that people who want to get the vaccine can't register online or our appointments have filled up. But we have not, that I'm aware of, turned people away once they come and once they have an appointment and we're all set to go. The only reason I could imagine that would happen is if the person is suddenly ill and maybe we choose not to give a vaccine at that point, or if they have had a significant anaphylactic, really, really bad allergic reaction to some of or one of the ingredients inside the vaccine. So outside of those somewhat unusual circumstances, I don't think we're turning anybody away at the time of vaccination.
Thank you. Gina, do you have anything to add on that?
Yeah, it's a good question, Trustee Oppenheimer. So we have a weekly call with school administrators on Monday and Friday, and I put a call out for anyone who was aware of any staff today. And granted, it's not attended by every school every Monday and Friday, but in that call out, I received a list of 10 staff out of our entire district that were unable for whatever reason to get their vaccine. And by the time they went to schedule, then the 65 and older had populated into those slots. And so we can reach out to districts and continue to do so and have a way to get them connected with a vaccinator sooner than later. And they don't necessarily, I don't want to call it wait in line. It feels like that, but they can connect with us and we can make sure that they get to a vaccinator since they're already in a subgroup that's active.
Any other trustees? Questions?
President Wagers.
Trustee Langley?
I just wanted to ask Gina, you guys track, CDH tracks COVID in person, and for Ada County, do you guys know, is the 2 school districts that are in person, are they having higher rates of COVID infection in the children?
Yeah, it's a really good question. I asked that question of my team explicitly, and the answer is it varies. It varies by individual classroom. It varies by, I'll share sometimes our investigations don't always align with an individual school's investigation. So they may come and say, we only have 3 people that need to be quarantined, and we'll do an investigation with that student or the family and recognize there's more than 3 people, maybe double that, and the recommendations for who is potentially exposed significantly does not align. And so I don't know. I asked them explicitly, do we have higher rates in the K through 5? I think I'll speak to K through 5 since those are the ones that are 5 days a week with the 2 larger districts. And they didn't indicate that there was those higher rates. We see higher quarantines as a result of that. And we never really know. The other question we tend to get secondary to that is how many of those quarantine turn into positives. And there's no way we can get that granular with our data because it's either not reported, or if you're in a family with someone who has an infection in their family unit, sometimes they often they choose not to test the other kiddos because they already know that it's COVID and they're presumed probable. So I don't believe at this time we are seeing that we can confirm. I'll also add, actually, if I could, their secondary comment to that is that particular grade tends to be more asymptomatic. So there's probably a lot going undetected that we're unaware of. And so it doesn't get added to those cases, obviously, if they aren't having symptoms and no one suspects that they are a carrier.
Do you have a follow-up?
I have another question.
Okay. Trustee Langley.
Gina, I'm sorry to put you on the spot, but I have another question for you. So you guys also follow community health in general. Have you seen an increase in neglect cases or difficulty with children, child abuse, et cetera, during this time?
Thank you. It's a good question. We as a department don't track child abuse cases. That's with the State Department of Health and Welfare. So I actually don't have an answer to your question, unfortunately. I'm happy to go look for it and circle back with the board if that's something that you would like to know about cases, particularly in Ada County even. I can find that information and get it to Lisa, who could share it with you.
Mr. President,
Dr. Brahmo?
well, my side job,
Dr. Brahmo.
thank you. My side job, other than working with the Boise School District on our weekly meetings, is I'm over the St. Luke's Children's Hospital with my partner, Katie Apple. And I will share with you, sadly, that there has been an uptick, a very sad uptick in child abuse cases in the last 12 months. There's also been an uptick in the number of fatalities due to child abuse in that same time. So sort of along the lines of our sad theme of mental health issues, this has affected some of our most vulnerable patients, to the point where, frankly, we're working on a series of press releases and interviews and whatever else we can do to try and talk to people about options for getting help.
Thank you.
President Wagers.
Langley, you had one more?
No, that was it.
Okay.
President Wagers.
Any other trustees?
President
Trustee
Wagers.
Oppenheimer. All right.
Thank you. I don't know if you can hear me, but following up with that, Dr. Bromwell, you were talking about child abuse going up, which I'm well aware of. That all being said, may I put you on the spot and say, is it safer for our youngest children to be in school or to be in environments where it's not safe at home? It's a balance of risks, right? So, and I know that that's a tough question to answer, but balancing that risk, is it safer for especially our younger kids, K through 2, to be in a safe environment at school where the risk of COVID might be lower than possibly at home where that home environment might not be safe?
Yeah, that's a great question, and I don't mind being put on the spot. It's okay. You know, that the challenge that we have is the people who are most at risk of child abuse, of being a victim of child abuse, are infants, particularly those who are less than 6 months of age. And by and large, they're not going to be in any sort of a school setting. They could be in a daycare setting, but they would not be in a school setting. So the larger issues seem to be sort of the economic downturn and the issues of stress and family coping mechanisms that then sort of play out with alcoholism and child abuse. So I don't know that our policies about school-age children will have a direct effect on the child abuse issues, but I do know that the number of cases that we've had in the last year have reached a point where even our child abuse experts, the CARES team, has said, what are we doing? What else can we possibly do? Because this is ugly. So I'm answering you as directly as I can. I'm just not sure that our school decisions will affect the child abuse issue directly.
Thank you. Trustee Oppenheimer, you have any follow-up?
President Wagers.
Trustee Gregory.
Thank you. I'm wondering if all three of you want to weigh in on this question. I'm interested in the impact that a more widespread, quicker return testing procedure would have on the safety of opening schools, and what barriers are there to us doing something like that, and what entity would do that?
Maybe we can start with Gina on that one.
Great.
She loves testing.
Yeah, it's a great question, Trustee Gregory. Obviously, if we had unlimited tests, we could surveillance schools. We had effective asymptomatic testing that was accessible to all families. It could certainly change the course of our ability to manage how we operate in schools. I don't know that we have that resource. I don't know that we have, I don't think you're asking me if we have the buy-in from families to be able to do that, but it requires a significant commitment and an ongoing commitment of resources and time to make that happen. It could allow us, and it would allow us to have accurate information at the time that we need it to be able to make better decisions. But there's certainly other factors at play, and I'm sure Dr. Nasser and Dr. Brahmo can add and elaborate on this piece.
Dr. Nasser?
Sure. Thanks, Trustee Gregory, for the question. I think we've come a long way with our testing, the technology, the capacity. We currently have now more capacity than we did a month or two ago, which is great. We also have the ability there's more ability to test in a rapid fashion, but much of that has to do with symptomatic patients who are expressing the virus, and to get those instant tests, the real standard for PCR testing still isn't an instant test. And really, I think what you're referring to is a complete shift of strategy. If we were to surveil healthy populations of people on a regular basis, not infrequent to how maybe some of the higher level sports teams, are doing or something like that, that would be a significant shift in our community strategy than what we've taken, which has been test those who are symptomatic or who are at risk, and that where we need to make a clinical or quarantine decision or treatment decision based on that result. So I don't know that we in our community are at a level where we could shift from a school standpoint to, nor am I sure that the teachers and the students and the families are ready, for that level of strategy. But you're touching on, another possible approach to the virus that would require probably more coordination and conversation if we were to go down that road, and probably more resources from a testing standpoint.
Dr. Brahmo, do you have anything to add?
Yeah, just that, the groups that have been able to institute surveillance testing really well have a compliant, cooperative population and usually unlimited funds. And so I don't know if we have either of those two things, is the nicest way I can say it, because the good tests, the ones that have an acceptable level of positive and negative accuracy, are still the PCR tests, which that's our rate limiting test right now, is having access to the most reliable tests. Because still, unfortunately, the best answer that you can get is a positive test, because that's right. Where a negative test, you don't know that that's right. And that's the limitation of us trying to get testing technology in front of a virus that we've really only known for 14 months. So we don't yet have the testing capacity to do that well yet.
Thank you. Any follow-up, Trustee Gregory?
No, but I did have one other question.
Sure. Go ahead.
Is there any way to anticipate, or do you anticipate a decrease in the number of COVID cases with fair weather coming ahead? Do we have a predictable expectation there? Statistically, is there anything out there?
Dr. Brahmo, you got to go first because you were talking about spring earlier.
Sure. Thank you, Mr. President. I will say that, a year ago when we were talking about this brand new virus, there was a lot of hopeful discussion about warm weather and dry weather and being out of doors. And as my son lives in Arizona currently, and it's been the epicenter of all things bad with COVID, that doesn't seem to play out consistently. The one thing that I'll say is that with all viruses, the more that people are away from each other, the harder it is for the virus to get transmitted from one person to another. And one of the big reasons that influenza happens every year, but this year is because people are in close spaces together and they're coughing on each other and shaking hands and doing whatever people do back when we used to see one another. And when the weather gets warmer, we're not around each other as much. So certainly to the extent that we are more separated and there are fewer cases, I think warm weather will help us out.
Thank you.
Anything to add from either Dr. Nasser or Gina?
Thank you. I think Dr. Bramwell described it well. We were surprised last summer. That was the second peak, I think, happened right in the middle of the summer, right when we were hoping that weather would play a bigger factor. So, like so many things with this virus, we have to, approach it humbly in the sense that it's hard to predict. But it has been a very interesting cold and flu season this year with all the risk mitigating factors that we've had. We haven't seen really a flu season like we have, most years, just with other viruses as well. So, we'll have to see what the summer brings and distance and outdoors as well.
Anything to add, or you good? Okay, thank you.
Good, thanks.
Any other questions from trustees?
Comment, President Wagers.
Trustee Gregory.
So I just wanted to thank the three of you, Dr. Nasser, Dr. Bramwell, and Gina Pinnell, for engaging with us and letting us think with you through your expertise. It has just been so invaluable for us. And because we're dealing with something that's very, very complex, and we appreciate your perspectives and your professionalism. It's just been very, very helpful to our board. Thank you so much.
Any other trustee comments? All right. Well, what I would echo what Trustee Gregory said. You guys are a treasure for us. In a very difficult time when there's no right answers, you at least provide clarity on the science, and we appreciate that. I know there's still not a lot of right answers even with the science, but at least we can trust you three in helping us through this and helping us make the best decisions, because we're asking a lot from our various stakeholders, from our families and from our students. They're under stress, from our teachers who are they're going in and out of various things, our staff who is trying to keep our schools clean. We're asking a lot, and with your help, it makes that ask a little bit easier. So thank you very much. And with that, we're going to give you a pass for the rest of the evening. But thanks once again for coming to another Boise School Board meeting. I'm sure this won't be your last, which is good for us. I don't know if it's good for you or not, but we're glad you're here. Thank you once again.
Thank you.
Thanks for having us.
Okay, so we'll move to the next topic, which will be a report on the board reopening exploratory committee update. So they'll give us an update on the committee and their progress so far. And starting out, Mr. Nick Smith, it looks like. President Wagers, trustees.
Hello? No. All right. President Wagers, trustees, it's my pleasure to give you a quick update on the data slides that I've been sharing with you at each board meeting. They disappeared. Oh, all right. So this first slide I have shared with you many times, but this is the updated data that shows the number of positive COVID-19 cases in the district. As you can see, we are halfway through this reporting period. We have 17 positive cases and 3 probable cases in the district as of today. This is just a breakdown of those same cases, the positive cases by secondary and elementary. You can see 10 of those cases have been at the secondary level, 7 of them at the elementary. Here's the positivity rate, 0.08 at the secondary level, 0.06 at the elementary. This is a new slide. And you will have more context for these next two slides in the next presentation from Director Anderson and her team that have been working on the reopening committee. But this is the positive cases per 100,000. And this is just another look at a lot of the same data that I've been sharing with you over the last couple months. But as you can see from this slide, we currently are at a little over 20 cases per 100,000. And that will have more relevance when Director Anderson and her team share with you in just a little bit.
Oh, one question. Sorry, Nick. So is that within the schools or is that within the community?
President Wagers, great question. This is within our school community only. So
Okay.
This is looking at students and staff in the Boise School District, that total population, and then applied through the factor. This slide is another look at, again, at the same kind of data, but just giving you a different perspective. Again, this will have more relevance when they share with you some of their reopening information. But as you can see, we're at 0.06% positivity rate. Again, this is just students and staff, Boise School District population total. And again, they'll share with some context soon. This is the number of probable cases by the reporting period. As you can see, we've had 1 secondary and 2 elementary probable cases during this 7-day period. This is a slide that I've shared with you over the last few meetings. This is cases reported during our winter athletics. So these are all cases associated with a winter sport or winter activities, extracurricular activities. You can see we've had 2 positive cases in this current 7-day reporting period cycle. We had 2 positive cases in the last reporting cycle with 1 probable. These are the number of quarantined staff and students. So as you can see, we had 752 on February 5th. Again, we're taking snapshots in time on this. We're looking at the number of quarantines during that week. And so we're reporting that every Friday at this point. So we had 752 as of last Friday, and you can see the breakdown there, elementary versus secondary as well. This is the same data, but a percentage just to give you some context of what we're looking at. And then this is a new slide, and we're going to be starting to report this data to you in our regular meetings as well. But this is a breakdown of quarantines, but staff versus students. As you can see, on February 5th, of our total, 711 of those quarantines were students, 41 of those quarantines were staff. This is important when we start talking about our operational abilities, right? When we talk about how many subs do we need and whatnot, the quarantine number for staff is important. So that's one of the reasons we started looking at this data through this lens. And that kind of dovetails into this next data that I shared with you guys on a regular basis. This is absences and fill rates by month. As you can see, in the month of February to date, we have 1,221 total absences or vacancies. And then of those, 454 of them needed filled. We have filled 382 of them. We have unfilled 77, which results in the next slide. As you can see, we're about an 84% fill rate for those that need filled, which is good. We're starting to climb back up. As I've shared with you guys before, we average about a 92 to 93% fill rate in a normal year. You can see we started the school year off in that ballpark. We're climbing back up towards that, which is a real positive thing. That's it. Any questions for me?
President Wager.
Trustee Doan.
I know you explained this before, but I forgot the answer. With a normal 92% fill rate, explain that to me and how that is. I forgot.
President Wagers and Trustee Doan. So in a typical year, we would average a 92 to 93% fill rate. So that means that of all the absences that we had that needed a substitute, 92% of them were getting filled by a substitute. This year, we have seen a lot lower numbers. Part of that is because of the sheer number of absences that are being taken, but a lot of that is also just substitutes not picking those jobs up. So I wouldn't say right now we're not seeing more absences than we would in a typical year. We're just seeing fewer substitutes picking up those jobs. There's a lot of reasons behind that. A lot of our substitutes are retired educators or retired citizens. They're in a vulnerable population. They're not comfortable working in a school setting. And so that impacts our fill rate.
Help me with what happens to the 8%, I guess.
President Wagers and Trustee Doan, that's a great question. So those that don't get filled oftentimes fall to our building principals to figure out how to fill that internally. So they may have teachers who on their prep are going to go cover for a fellow teacher whose job didn't get filled. And so that teacher's workload may have been filled by 6 different teachers throughout the day. Another example at the elementary, you might pull a classified employee and have them cover that class for the full day. Any further questions for me?
President Wagers.
Yeah, Trustee Esty? Oh, Trustee Greeley, sorry.
No worries.
This is right.
Director Smith, do you have any data on subs getting vaccinated?
President Wagers and Trustee Greeley, that's a great question. We do not have that data, but because the way, well, as the reopening committee is going to share with you in a bit, we are working on getting all of that data in HR. We are collecting records of vaccinations. They have done some preliminary collection of that data via the principals, but the principals would not be collecting that for substitutes. That is something that my department, we could work on that, and we will. That's a great question.
Thank you.
President Wagers, follow up.
Trustee Langley?
As follow up to that question, can you talk about how you have, hi.
I was Hello.
Can you talk about how we have offered vaccination to our substitute pool?
President Wagers and Trustee Langley, that great question. I was actually going to do that as a follow-up, and then I was like, we have offered, and our substitutes are eligible to get the vaccination. And we have had many subs reach out to us asking about the ability to get the vaccine. We've been giving them, they have received all the same information as our full-time and part-time employees. And we've continued to provide additional information to them through our substitute office to make sure they are getting that information. We followed up with our substitutes one-on-one with many of them reaching out, needing additional information. We've continued to provide that to them. We also have sent out information through some of our releases and some of our social media, letting people know that we are still onboarding substitutes and still hiring substitutes at this time, and making it known that substitutes for the Boise School District can receive the vaccine. So we've been kind of marketing and sending that information out, and we continue to onboard new subs, and actually are fairly busy with the onboarding of new subs at this time. And I think a lot of that is because they are eligible for the vaccine. Any other questions?
President Wagers?
Yes.
President, thank you. Director Smith, thank you. You had a slide that indicated that I think it's current that 41 staff and 711 students are quarantined. Is that, first of all, is that a point in time? Second of all, can you give us a percentage of that? So 41 out of X number staff are in quarantine, 711, there you go, 711 students are in quarantine out of, I think that we always use like 25,000 or something. Is that a high number, low number typically? Could you give us a little bit more information on that?
President Wagers and Trustee Oppenheimer. So to give you a little bit of perspective on the staff number, that's 41 staff members out of what we're probably about 4,500 staff members. So it's going to be a percentage-wise, it's going to be very, very, very small. 711 students out of, what are we about, 27,000 students? 25,000 students. So I need one of my mathematicians. Is that the staff one? The student one is 0.02844%. And which of my other math friends is going to help me on the and 0.009% on the staff front. Thanks, math friends.
Thank you. Can a follow up, please, on that?
Trustee Oppenheimer.
That was great math. With the 711 students, the 0.009% of students who are in quarantine, are they participating in virtual school even though they're in quarantine, or are they just not doing school for 14 days? What does that look like?
President Wagers and Trustee Oppenheimer, they are receiving instruction. I've got lots of principals in the room here and they're kind of shaking their heads and nodding. Yes, they continue to receive instruction. Some of that might be on virtual, some of it might be in information sent home to students, just like we typically would with a student who's absent. And so it just depends on the teacher, depends on the classroom, depends on the school, but they're continuing their education and their instruction from home during that quarantine period.
Okay, great. Thank you.
President Wagers.
Trustee Esty.
Director Smith, do you have conversion data for students and staff who are in quarantine?
Can you?
Sorry, conversion data. Do you track how many of your students and staff who are in quarantine actually convert to positive?
Yeah, I think Trustee Esty's asking about conversion, actually where they are testing positive after being quarantined.
Yeah, President Wagers, I'm going to defer to Tamara Fredrickson. The number of people who we quarantine that eventually end up testing positive. Do we have that exact data?
We have not been tracking that data. That would be possible, but we do not have that.
Impossible.
Yeah, so Trustee Esty, I'm not sure if you caught that or not, but we have not been tracking that data, but it is possible for us to do that, and we could start doing that.
Thank you. I think that would be helpful for us to understand just the delta between how many people we're quarantining and how many people convert as we make these decisions about returning to 5 days a week face-to-face.
Yeah, I think, President Wagers and Trustee Esty, we'll absolutely start looking at collecting that data. I will say, I think the number is quite low, just based on what we have observed, but it'll be nice to actually track the actual data.
Yeah, I would agree. That I'd like that also to understand the quarantine length. Whether it's 10 or 14 days, and whether we're getting that's proved useful. I know we like to go to the gold standard, but at what point would we move to maybe a 10-day quarantine possibly?
President
questions
Wagers
from trustees?
Yeah, President Wagers, I have one more question, please.
Trustee Oppenheimer.
Well, it's probably not one more, but of the 711 students, Nick, do you have, and maybe you showed it on the slide and I missed it, do you have that broken down, our K through 2 or elementary versus high school? Maybe you showed that in quarantine?
President Wagers and Trustee Oppenheimer, yep, we're just going to pull that up right here. This is the breakdown of that. It's nearly 50-50, as you can see, on elementary versus secondary.
Okay, and do you by chance have that broken down with the elementary? Do you have that broken down pre-K through 2nd grade and then 3rd grade through 6th grade by any chance?
President Wagers and Trustee Oppenheimer, not at this time. At this time, we've been collecting it just at the school level.
Okay.
Part of that is because we aren't collecting data down at that fine level for trying to protect the identities of individuals. So we collect it in the aggregate by school, and that's how we've been collecting.
Okay, thank you.
President Wagers,
Trustee Langley?
can we look back at the actual positive cases number versus elementary and secondary? So my question to you is, why is there a difference, such a vast difference in the case count numbers versus the quarantine numbers? So it's clearly not 50-50 for our positive cases in secondary versus elementary. What's the trend there, or why?
So President Wagers and Trustee Langley, just to reiterate your question, make sure I'm understanding. So the fact that we have, I'm going to go back one reporting period, we have 31 positive secondary, but yet the quarantining numbers seem to be 50-50. Why is there that discrepancy? That's a good question. I don't have an answer to. Tamara?
Dr. Smith, I could speak to that. President Wagers, Trustee Langley, the quarantine data is dependent on those students who are exposed, and that exposure may be happening at home from family members, or it may be happening in school, versus the positive and probable case numbers that you're seeing are just our students in our school buildings. Does that help answer the question?
Very much so, thank you.
Okay.
Any other questions from trustees?
For the record, I was going to go quickly through those data slides to leave time for Director Anderson and her team.
I think we want to hear from everybody. We'll give everybody plenty of time.
Thank you.
Okay. Well, good evening, everyone. We are going, this is a team effort, so Stephanie Myers and myself are going to get started first, but then we're going to turn it over to many of our friends who helped us out. We are giving you an update on the work that the 5 days a week exploratory committee has been doing since the last time we were visiting with you. So just wanted to remind you about our objectives. We're a group of stakeholders that are researching and gathering input to give you the tools we think you need to make the decision that you feel is well informed. So our committee has taken that to heart. We will be presenting our findings to Executive Council and Cabinet, who will then in turn take that to the Board Reopening Committee and the Board of Trustees. These interests are the interests that we developed with the whole committee, and Stephanie's going to talk a little bit about what it means, what are interests, and what does that mean to our process.
Good evening. We use the process called interest-based decision-making. And in that process, we've used that process for 25 years now. And when we have to make difficult decisions where there are sides of for and against, or if we are coming to a consensus, that's how we make decisions. And interests are the guiding principles, the things that we want the most to remember that we're striving for. And so our interests, and you can read them, and we've presented them in rough draft form, but we took that off. So now they are finalized. Our interests really are about safety for our students and our staff. We want to be database and methodical. We want to mitigate risk. We want to be flexible and creative. We want to strive for recommendations that are balanced and have consistency. We gather input from all of our stakeholders. We will consult with our medical partners, as we've done tonight and several times every week. We consider equity between all of our students. We want to address the needs of the whole student. And we've talked a lot about academic and social, emotional, and co-curricular. We are honest and transparent, and we are empathetic and respectful. And when Becca and I started this process with our entire committee, that's really what we wanted to impart upon them. And I can tell you that as someone who's been in the district for 25 years and a teacher and now the BEA president, the people that are on this committee absolutely live by those interests. And we've created options and we're doing research so that when the solutions come forward, they mean something.
And that was a nice segue into who is on the committee. We have a very big tent. We have 5 teachers, 5 principals, 5 parents, 2 school nurses. Tamara Frederickson is indispensable, our health services administrator. Stephanie and myself, and then 5 principals, and many of whom you will get to hear from tonight. We've had a few questions come up about actually who's on the committee and how those folks got chosen. So in the past, and we did this the same this time, when we form a joint committee with the Boise Education Association, we sit together and go through folks who've expressed interest, but we really strive to look for balance in a committee. So all 4 quadrants, non-title, title schools, big schools, little schools. We were really fortunate in them when, I'm trying to think if it was the last board meeting, but when the announcement was made in this forum that we were going to form a committee, we had many parents come forth and offer to volunteer. I don't know that they really completely understood what they were getting themselves into, but it was kind of a happy accident. If you look at who's on the committee with us, we have a nice spread of folks who have children that are from K-12 in all of our quadrants, and who are actually on the spectrum of how they feel about the return to school. And so we can't thank those folks enough. You know, they are giving of their time. So that's the committee. And then we're going to hear right now from the different working groups. We have a joint committee meeting planned for the 16th. All the working groups met at least twice prior to meeting together as a whole group today. And again, we're going to plan on presenting to the board March 8th. So I believe it's Jolene Lincoln, principal at Whitney, and Director Brian Walker. Sorry, I didn't.
Good evening. Good evening. So our committee was the logistics committee, and what we looked at 4 different areas. One area was the impact on operations. So we reached out to food service, transportation, our daycares, JFK, and asked them what considerations they would want you to know. And that was the timeline that they would need to hire their staff back to full capacity. Another area was the vaccinations and percentage of staff that have received vaccine, and that is important to operations because that has an impact on the number of days for quarantine for staff. And then the next area was Director Walker will.
Yes, President Wagers and trustees. One of the main areas that we looked at in the logistic committee was looking at mitigation strategies and how, if we were to move to 5 days a week, how do we make that as safe as possible? And our centerpiece that we looked at, it's been referred to a number of times tonight by the doctors, is the CDC indicators and thresholds that is provided for reopening schools. And it was, I believe it was mentioned earlier, but this is something that is being revisited by the CDC, and we should have an updated version of this later this week.
Director Walker, could we walk through each one of those and kind of, because I went through this earlier, and see where we are? I mean, because each one is a separate gauge of where we are, and I just kind of like to see where we are in moderating risk in each one of those indicators. Because I've had other folks say, hey, you guys should be looking at this harder. I know that our committee is, but I don't know the trustees fully understand where we are in each one of those areas.
Yes, President Wagers, absolutely, we can talk about that. So looking at this chart, and I'm going to have Nick Smith help with this, with the data he just went over. But when you look at the core indicators, those first two items is looking at number of new cases per 100,000 within the last 14 days. And then the other one, the positivity rate. And up above the metric, the indicators they have, obviously, I mean, on the far right is red, that's the highest risk. And then it works its way back to the green where we'd be at our lowest risk. So I can tell you this, in the Ada County, we are currently, based on the information we got today, we're in that yellow category. But Nick Smith can share with us where we would fall within our school district based on our district data.
President Wagers and trustees. So based on the data that I just shared with you, and this is kind of what I was referencing during my presentation, was this document would give you more context to the data I was sharing with you. But if you go back to that slide that talked about the cases per 100,000, we were just over 20 cases per 100,000. So we are right there on that borderline between the second green column and the yellow column. When we look at the percentage positivity rate, we were lower than 5%. I believe we were lower than 3%. So you would find us in that lowest category in the green zone. And then I'll let Director Walker talk you through the third area there.
Yeah, so that brings us, if both of those areas are in alignment in good shape, then that takes us to the third core area that you have to look at. That's the 5 key mitigation strategies. And our committee, when we looked at, our subcommittee looked at this, and overwhelmingly, when we looked at right now, the district in a hybrid, we do all of these things. And we are doing all of these things consistently based on the criteria they have there and implementing them correctly. The two areas, when you start talking about going 5 days a week, the two areas that we spent more time talking about, one was the social distancing, and then 2, the contact tracing. And when you look at the language the CDC uses there, social distancing to the largest extent possible, that raised a big question to us. Do we truly know across our district what we're able to do in every classroom? And so we actually collected that data and had our principals go into every classroom and look at what our conditions were and how much distancing we could have based on the class sizes we knew about. So if we go back to the presentation. So these are the percentages across the district. 31% of the classrooms can get 6 feet or more. 85% of our high schools could get 3 feet or more in each classroom, 85% of our classrooms. 89% in the junior highs, and then 79% in the elementary schools. Any questions about that?
President Wagers.
Yeah, Superintendent Comments.
Brian, maybe you could give a little bit more of a breakdown as far as how you went about collecting the data for the board and the different categories you asked the principals to look at in each one of those schools.
Sure. President Wagers, trustees, we gave principals 3 categories: 6 feet or more, 3 to 5 feet, and less than 3 feet. And so when you look at those numbers, 31%, which doesn't seem like a high percentage, but when you look at our district, the diverse buildings that we have, and the class sizes, you have to factor that in. And then the 3 feet or more, that we're actually hitting a very high percentage with those. Another way to look at this from a quarantine standpoint is if 31% are hitting 6 feet, you have 69% that are less than 6 feet.
President Wagers, follow up.
Sure. Superintendent Dennis.
Brian, can you talk about the total number of classrooms district-wide that could meet the 3 or greater?
So total number.
So a general percentage, you're talking about and
Yeah.
I think. Okay.
So a general percentage would be 83%.
Follow up.
Yes.
So, Brian, given that and what we heard with the doctors today and Central District, or not, excuse me, CDC's guidance and the Academy of Pediatrics, that 3 to 6 feet distance is really what we're talking about when we get into the conversation around bringing kids back 5 days a week, and because of the number of kids we were going to have in each classroom. Is that a fair statement?
Yes, that is a fair statement. So the next piece here that we would have to look at, and I believe Gina talked about this, is anything that's under 6 feet is you have to look at some other solutions. And that could be bringing in additional PPE. Gina, as you heard her earlier, mentioned pods. Pods is a strategy where you would create pods within a classroom of say 3 to 5 kids. So to minimize your risk, if you had a positive case, only the other kids in that pod would have to quarantine.
President Wagers.
Go ahead, trustee.
Thank you. Director Walker, thank you for this. Of the 31% of the classrooms with 6 feet or more, do you have a breakdown? Because you've got the 3 feet or more listed there, but of the 31% of all classrooms 6 feet or more, can you give us a breakdown of how many of that are elementary, and specifically how many of those are pre-K through 2nd grade versus 3 through 6 and then so on?
President Wagers, trustee Oppenheimer, we did not add that data. We did not, but we could easily look at that and pull that out.
President Wagers.
Trustee Langley.
I wonder if there's also a possibility of looking at the distance in special needs classrooms to see that specific band of students and how we can address their spacing.
Yeah, President Wagers, trustee Langley, we did include that in this data that we looked at all classrooms. So we looked at our special ed classrooms based on their class size, number of students, number of people in the room. And so that's all included in this data.
Oh,
Trustee Langley.
I'd just like to see it broken out from the data, just to see if
Yeah.
we could, how we would deal with just that group.
Yep, we can definitely pull that out also.
President Wagers, follow up. Oh, sorry, Alicia.
Trustee Oppenheimer.
No, go ahead.
I wanted to, actually, Director Walker, I wanted to follow up to Trustee Langley's question about the special ed classrooms. I mean, if you were to estimate, would you say that the majority of our special ed classrooms met that 6 foot social distancing, or would they be more in that 3 foot category?
President Wagers, trustee Oppenheimer, with not having looked at it, just going off my best guess. My guess is yes, that many of our special programs would meet that because they have fewer kids in the classroom, in the classroom space, but not necessarily in some of our general special ed resource rooms because they tend to have more students.
Mm-hmm. Okay, thank you.
Any other follow-ups at this point?
I have a question, President Wagers.
Trustee Greeley? Esty?
Yeah.
Sorry, I can't even see lips
That's
moving.
okay.
They're way
We
away.
should probably use our raise hand functions. I mean, we are a school board, so I think that would make it easier. Director Walker, how difficult would it be to set classrooms up where you can't get that 6 feet of continuous physical distancing into pods? Isn't that just moving desks in arrangements of 4 or smaller?
Yeah, President Wagers, Trustee Esty. It actually, we've experimented with that a little bit. When we're collecting this data, we've asked a few principals to set up some different looks within classrooms. And for example, took a look at a classroom out at Riverside, and we were able to successfully put 5 different pods within that classroom.
And follow up,
Go ahead.
beyond that, could you not put plexiglass between the desks and the pods as well?
President Wagers, Trustee Estes, one of the goals with the pods is you have 6 feet between each pod, so you would not need the plexiglass. PPE could be a potential solution in some situations, but I think the pod method will be in those classrooms that can't get 6 feet will be the primary focus for our classrooms.
President Wagers.
Oh, and I can clarify. President Wagers, Trustee SC, that could be an additional measure if you're talking about plexiglass in a group of 4 between all the kids in that group. That is something that can be considered.
Yes, thank you. I'm just thinking that trying to get kids to wear additional PPE will be a nightmare. So I would recommend plexiglass.
Superintendent Dennis.
Thank you, President Wagers. Brian, can you talk a little bit about part of the reopening would need to be the team that you would like to take into buildings? Can you talk a little bit about that?
Yes, that's actually coming up in the next slide, Superintendent Dennis, and I will touch on that. Real quick before I go to this slide, contact tracing, obviously, as you heard earlier from Gina, if you double the number of students coming into the schools and you're changing some of your distancing parameters, some of that, there may be more contact tracing that needs to occur. And so one of the things is that will create a challenge for our district in looking at how can we continue to consistently do this at the level we have been able to do it. Okay. So other things to consider that the group came up with was building teams are going to need time to look at, again, the non-instructional times, the recesses, the lunches, before school, after school. They've already spent, buildings have spent significant time looking at these areas, but they will need some additional time to look at that. One of the things the group came up with is the development of a district pandemic problem-solving team that could be a resource for buildings when they're not able to solve some of their logistics. So that would be a group, up there that would include health services, safety and security, facilities and operations, and district administration. Last thing is school by school closures, going back. One of the things we talked about is what would the criteria be for when you would have to close a school. And our group felt like the operational impact based on positive cases and quarantines of staff members would be significantly different based on the number of vaccines that we've seen with our employees across the district, or that they're in process of getting. So with that, really, we feel like you'd be dealing with this more on a case-by-case basis, and it would be more at the classroom level versus school level. So next slide.
Members of the board, the last item we looked at was the expectations for staff, for student services staff, and also for parents for when students are put in quarantine and what that looks like when it's 5 days a week and teachers are instructing 5 days a week while also having students at home 5 days a week. So we talked about having clear expectations for what that looks like for staff, parents, and students. And then also having a plan in place for those that choose not to send their students back. If they're currently in the hybrid, having a clear expectations or plan for those families that are still not comfortable.
So we don't have a distinct plan on that yet. That's still to be determined by the committee through this process.
President Wagers, members of the board, exactly. When we went into remote, we had expectations lined out for elementary and for secondary for when we went remote, and those were guidelines that were consistent across the district. So similar situation.
Thank you.
President Wagers, trustees, any further questions in the area of logistics?
Trustee Dunn?
I just wanted to ask a follow-up on that, make sure that I got it straight. So what you're saying is a plan for if we do go back, students or parents that feel uncomfortable. And my memory is, didn't we tell them their option was online? So I know we need to build a plan, but I also have very little sympathy. How about that? So, I don't want to work a plan too much. The plan is you should have done what we said and put your kid in online school. Am I being too blunt? Like normal?
President Wagers, trustee Doan. No, you were right on. One of the challenges, I'll just say from the secondary standpoint, is the Boise Online School is in a quarter system where we're in a semester system in the traditional school. So as far as options, that's not an option around, at this point in time as we move forward, because it would not match up from their schedule standpoint. But with that being said, we do have, to some extent, we have a responsibility to provide an education to all students, and we need to make sure that we're doing everything we can to help all families. But I believe you are right on.
Any other questions from trustees on the first logistics? Okay, let's go ahead and move on to data sources and data tracking.
President Wagers, members of the board, I just would like to revisit as a part of the data sources and data tracking work group. I'd like to revisit the CDC decision-making indicators. Our group, as well as we looked at the researched and looked at the various indicators that you could possibly consider. We wanted to give you a benchmark or a framework for those indicators. And as Director Walker went through them, I think he talked very well to the school indicators that are on the top of this chart. But if you scroll down, the secondary indicators are those that are community indicators. And as Gina Pinnell said this evening, Ada County and Central District Health calculates their rate a little differently that's on this CDC chart. But I think it's still important for you to have a sense of what our indicators are doing countywide. And so 2 weeks ago, we were at 41.74% or per 100,000. And now we're at 24.21. Last week, we were at 28.76. We are currently at a 6% positivity rate in the county, in Central District Health District, I should say. You can go back to this slide, please, Becca. We also thought as a work group that it was important to consider hospital capacity and the vaccine rollout of the 65-year-olds and above. And we thought about this very specifically in the rationale that age group, as Gina Pinnell pointed out, is the age group that are going to contribute more to the increased workload of the hospital, the increased capacity of the hospitals. And so the fact that they're now rolling out is something to take into consideration. To back up just a bit, our group did a little research, and the other reason that it's important to be looking at community indicators is because as we researched nationwide and worldwide, those schools that have opened up fully, those schools that had the biggest success rate in opening up and staying open were in those areas with low community transmission. Moving on to district indicators, and a lot of this has been covered already by Director Smith and Director Walker, but we felt as a work group it was important for you to look at the district positive and probable case rates, break it down by the school and grade band case rates, as Director Smith talked about earlier, the student and staff quarantine rates, as you saw again in Director Smith's slide. And again, just to reiterate why that's important is we feel as staff have the opportunity to be fully immunized, that you will see the staff quarantine rates decline in correlation with that. And then the last two are the staff vaccination rates. And again, the staff vaccination rates, we didn't talk about specifically, but we have had our principals gathering data in this area for an operational reason, and as well just for us to collect some data around it. And our lowest school has about 51% of staff participating in the COVID vaccination opportunity. And we have schools that are upward to 91 to 95% participation rate by staff, with the median being somewhere in the 70 to 80% range in most of our schools. And finally, I would be remiss in not mentioning how important it is that our work group thought we should look at the student academic and social emotional data. Because as you have talked about tonight, as our educators on our committee and our administrators on our committee have voiced, we have seen an impact of this pandemic on our students of our district, both from an academic standpoint and a social emotional standpoint. We don't have a complete picture in regard to the data around that, but we are in the process of gathering that. And with that, I will stand for questions.
I have one quick on the staff vaccination rates. Do you have a date in mind on when you feel like the majority of staff will have been vaccinated, and then also have the 2 weeks after their final vaccination?
President Wagers, members of the board, that is a great question. That depending on when staff were able to access the vaccine and actually get their appointments for their first and second vaccinations, they should be 2 weeks post that or fully immunized somewhere between March 1st and March 19th.
Thank you. Any other questions from trustees? All right, we can move on to stakeholder input.
Good evening, President Wagers, members of the board. My name is Deborah Watts. I'm the principal at River Glen Junior High. And I was asked to facilitate the group that was researching stakeholder input. And we had 4 guiding questions that our group looked at. The first question was, which stakeholders do we feel that we needed to solicit input from to bring to the board? Those were our parents and guardians, our staff, and then students, if we could. And then our next guiding question was, how can we reach the highest percentage of our stakeholders in a timely manner so that we could gather as much information as possible to bring to the board as quickly as possible? Then our third guiding question was, what exact input are we seeking from our stakeholders? What questions are we trying to answer in this attempt to gather information and input from them? And then our fourth was, is there a way to educate regarding the logistics and gather input simultaneously? So was there a way that we could design our input collection form? In this case, we chose to do surveys in a way that we could also educate on some of the logistics that we felt our stakeholders would need to understand should we be looking at bringing all students back in 5 days per week. So after looking at those questions and discussing our options, we decided as a group that we really did want to focus on surveys. We decided to use Google surveys. We wanted to do 3 parallel surveys and target them to each of those 3 stakeholder groups that we wanted to look at. We did look at the possibility of some focus groups as well, but decided that we were going to start with the Google survey method of soliciting input. We did that for a number of reasons. The first was there's familiarity for our students and for our parents and for our staff members. It's a form of input or a device for input that we use frequently. The second was the ease of data collection for us, at least in this initial phase. And the third was the translation capabilities so that our parents and students that have English as a second language or perhaps don't speak or read English would be able to access the surveys. And so that's where we started. We were also very fortunate when we designed those 3 parallel surveys that we were able to submit them over to or share them with the Office of Institutional Research at Boise State and get some feedback on the validity of our questions and the structure of our survey. And we were able to do that all. They were fantastic at getting back with us very quickly and with some recommendations that we were able to incorporate and get those first surveys out. Thank you.
President Wagers and Board of Trustees. And the content of the surveys that Principal Watts was just describing is that the first question we asked our parents, guardians, staff, and students is about physical distancing, because we knew that that was the one mitigating factor that we were going to struggle with if we were to move to 5 days a week in-person learning. And so that was the very first question we asked. We then asked each group whether they support moving to 5 days a week in person, 5 days a week in person, or whether they oppose moving to 5 days a week in person learning, which would mean that we would stay in the hybrid. We asked the parents and the staff to answer those 2 questions based on grade levels. So we asked the question for pre-K to 6, and then we asked the question again for grades 7 through 12. Parents and staff also have the option to say that they do not work with or have students in those grade levels. And then we asked some demographic information. We asked whether or not they were parents or staff or students in 7 through 9, 10 through 12, or pre-K and 6. And then finally, we gave everyone the opportunity to leave a comment if they would like to. So those surveys went out today, and they will be available for our parents, guardians, staff, and secondary students through Friday at 4 p.m. And we feel very confident that we would be able to have preliminary results for the board by Tuesday, February 16th. Does the board have any questions about the surveys that we are using to collect some stakeholder input?
Dr. Thamer, just a quick one. About how many surveys was that? How many did you send out? Or how many do you expect? I mean, how many individuals?
President Wagers, we sent the parent guardian survey to approximately 26,000 email addresses. We sent the staff survey to approximately 4,500 email addresses. And we sent the secondary student survey to approximately 11,000 email addresses.
Thank you. Any other questions from trustees?
All right, thank you.
Thank
We're
you.
going to turn it back over to Mr. Gerber, Principal Gerber.
Models of return.
Yes, good evening, President Wagers and trustees. I'm Darrell Gerber. I'm the principal at East Junior High. And I got to be on the subcommittee of models of return. And first, I'd just like to share, we had a very diverse group, which was, we were able to brainstorm just a variety of different methods once the decision was made to return on what that would look like. And so we brainstormed during the evening and then came up by picking and choosing and kind of putting several together, just our top 3 proposals. And there are no order of preference. The first one is just all in 5 days a week. So when the decision was made, we would just go Monday through Friday, K through 12. And we listed some pros and cons that we talked about. The pro about all in 5 days a week would be, it'd be predictable. Families would know what to expect. It wouldn't be a staggered approach and seem like it might be easier for them. However, some cons could be, it could maybe overwhelm the substitute situation if we just flood everybody back at once. We weren't sure when the decision would be made to return if every staff member was fully vaccinated, and thought maybe it could overwhelm food service. The second model of returning was more of a phased in approach, which was very similar to the one when we came back in hybrid. And that we would start K through 2, and then a week later, start 3 through 6. And then another week later, we would start 7 through 12. We would also maintain in this model virtual Mondays until when we hit the phase in of 7 through 12, then we would start 5 days a week and eliminate the virtual Mondays. The pros for that is starting out with virtual Mondays through that phase is if there was some contact tracing we'd have to do, a lot of times it happened over the weekend. We would be able to work on that Monday morning because it was a virtual kind of phase in. So we have virtual Mondays to do that contact tracing and make sure nobody who wasn't supposed to be coming back would be at school. So that would give us an extra day. So that would be one of the pros. It also would just not overwhelm the system by doing that phased in, just whether it's support for emotional needs or just a variety of different things that we just kind of gradually go in. The cons of that one is we have several more first days of school. We've already experienced several first days of school, which can be fun. It can be hard on families and maybe confusing. And one thing our district does really well is we communicate very well, but there's still always lots of questions when you do a variety of different phases like that. The third model of return is we would maintain virtual Monday for a while and then just do all in Tuesday through Friday. And we would do that for, we did not set a exact time for that, but we'd just be all in Tuesday through Friday. And then after a while, we'd phase back in Monday. And that would also give us some of the pros of the same of above, where it allow us Mondays to do some contact tracing, and make sure everybody who was supposed to be coming back would be coming back or not if there was some quarantining that needed to happen. Again, the cons are just changing schedules and maybe some confusion with understanding some of the communications going out. And then I will turn over to Director Donovan to talk about the special ed.
Okay, President Wagers, trustees. So in option 2, in the phase-in, we would like to offer all of our special ed district programs. So like Excel, all the self-contained program kids would return to in-person whenever that phase-in approach started. So if, let's say I was in a 7 through 12 SLC class, I would still start when the K2 came, so that they came right when we started go. Also, I wanted to let you know, if you're not aware, currently right now, we have lots of our special ed program kids coming back right now in person. We've added days. They could be coming back 3 days a week or even up to 4 days a week, depending on IEP teams as they're meeting with families. We also have many EL students, our English learner students that are at risk. Mostly our secondary EL students, they are also being offered to come back in person an additional day or possibly 4 days, depending on what's going on in their lives, again, with the teams at school doing that. And our pre-K, our Boise pre-K students, those are the ones at Whitney, Hawthorne, and Whittier. We are bringing those students back by the end of September, or by the end of February, sorry. By the end of February, their class sizes are so low right now, and we're able to do the distancing. And again, those kids have struggled because that's difficult to do online learning when you are a pre-K student. So they're in the process of coming back as well. Any questions for Principal Gerber or myself?
Trustee Wagers.
Trustee Langley.
Can you just give me an update about why, I think I've read this before, but I'd like to hear your opinion about why Mondays, dropping Mondays would be beneficial to the district.
Dropping Mondays, you mean?
Having 4 days.
Virtual Mondays instead of 5 days a week. So on the second 2, you had virtual Mondays at first.
Okay.
So
since on K2, when we're phasing in, because they would be going, not everyone would be going 5 days a week, we felt that the virtual Mondays still allowed for, if as a school, they can be kind of on the same calendar on that Monday. Again, allowing for the contact tracing, allowing for not to overwhelm the system. But again, virtual Mondays can be, when we do go back 5 days, we don't want to have the virtual Mondays continue, because if we could do 4 days, the intent we could do 5 days. Do you want to add anything?
Yeah, I think one of the things that the subcommittee was talking about is a lot of stuff in our community happens over the weekend. So once we start coming back, I start getting phone calls on Sunday that we've had an exposure or different things. And we thought once we are all coming back, we would still have time on Monday to start doing that contact tracing as we're getting back into that groove and start making sure. So the reasons that Director Donovan said, and then the contact tracing were a couple that the subcommittee were talking about.
any other questions for models of return?
President Wagers.
Trustee Oppenheimer.
Thank you. Director Donovan, you mentioned that our special ed classes, as well as our preschool classes, they're starting to come back 4 days a week, if I understood you correctly. Can you give us a percentage of how many children are coming back right now, or who are in school right now versus who are not in that category?
President Wagers, Trustee Oppenheimer. I don't have an exact percent. Again, those are based on the IEP teams, because even an IEP team could meet with a family and suggest that. They're not willing to take us up on that. We did have some preliminary numbers early in the week last week. I don't have them with me now, but I could get them to you earlier last week. But teams are meeting continually to try to get more families to take them up on it.
Follow up, please.
Go ahead.
And if I understood you correctly, and I could be wrong, Director Donovan, you have been reaching out to these families, our special ed community, as well as our pre-K, to offer them to come back to it, if I understood that correctly. And you're saying that not all of them are wanting or willing to come back. Do you have a sense of why they're not wanting to come back, if they're choosing not to come back?
I think it's the same reason that a lot of our families are. They're not sure that we're able to possibly do the distancing. The system that they're using, how they're working through the virtual seems to be working for the family. They don't want to disrupt it until they maybe have to. They could, like in the pre-K, it could be, and we're in the process of the pre-K project kids to come back. So it could be that they've got a system, they've got a daycare set up. Then they don't want to change that until we make that move. But so it's an individual. That's why in the special ed and the ELs, those are teams that are working with the families to help the family make that decision. It's not just a matter of come on back, we want you right now. The families are weighing those options based on a lot of the information that was shared tonight on the safety and the distancing, et cetera.
Any other questions on models of return? Thank you. Back to Director Anderson.
Okay, so we just wanted to kind of give you the status of where we are as of today. As Dr. Thamer shared, the results will be ready for the surveys, the 3 different surveys. We think we can get those things put together by the 16th. Our joint committee meeting is scheduled for the 16th at 4. We want to make sure that they get a chance to close the loop, get to see the results of the survey, and come back to some of these things. The staff percentage of vaccination rates are being updated in 2 phases. So the principals have done those surveys now. Those were really focused on operations, but it gives us good initial information on who's already taken advantage of the vaccine and who's planning on getting their second and when. The Human Resources Department is documenting it in a little more formal way. As employees are getting their second shot, they are uploading that vaccination card into Winocular. It's going into a medical file, so it's highly confidential. But as folks, let's say you're a special education para, as you are potentially exposed to someone, principals will have access to that information so that they can make determinations on who has to quarantine or who does not have to. So that will be also an opportunity for us to have a pretty firm sense of who has gotten both of their vaccines and are immune. As I think it was Dr. Bramwell made mention of, we're hearing that either Tuesday or Wednesday, there's going to be updated guidance from the CDC, and then CDH will take those things into consideration and make recommendations. From Tamara and also from what Brian Walker have looked at, we're not anticipating that those things are going to rock our world that much. All the things that they're talking about are all the things that are on that indicator chart. But we will, of course, look at that and make sure that what we have given you as recommendations are in line with those new guidance documents. The last thing, or the last couple things, one is the estimate of the staff opportunity. Tamara already said she put it between the 1st and the 19th, so I split the difference and said March 8th. And then as we made mention of, even though it's not really data that would say when or how you should return, we are trying to collect some data just to recognize the impact on academics and social emotional, student learning and students' well-being. We are trying to collect that, and our work group has done a really nice job reaching out and working on that. So sometimes it's super hard to quantify. We kicked around like attendance, but oh my gosh, there's so many things that go into student attendance at this point that we're going to be able to put some things together, but I think it's causation and correlation. Those things can sometimes be really hard to put a finger on right now. So that's, we're working on collecting some of that for you. And I think that is it, except if you have any other questions.
Trustees, questions on the update from the committee?
Oh, and I wanted to thank all of the principals and Stephanie for coming tonight, and Tamara Frederickson, and everybody that participated in the committee, because honestly, I have been on a lot of committees and we were really blessed. These folks were amazing. So big thank you to them.
Well, and as a little follow-up to that, I know maybe the board pushed your timeline a little bit, and just and not necessarily the timeline, but actually the urgency of doing this, and we really appreciate both the committee's time and the administration's time and attention to that, because we know it's important to our community, and we'd like to thank your ability to take a lot of time out of your lives and meet. And
well, and a big thank you to our parents for taking that time. But I think if COVID has taught us anything, it's to be agile. So we are getting really good at that, aren't we, principals?
okay. Any other trustee questions on the update from the committee? Okay.
President Wagers, I have a question.
Sure. Trustee
And I'm not sure who to direct this to, but and I'm sorry if I missed it, but when is the earliest a committee would be able to come back to the board and make a recommendation?
President Wagers and Trustee Esty, I feel that our next meeting, which is on the 16th, we'll get an opportunity to come back to all the survey results. And I'm looking at my committee members. I feel like we'll have a lot of, we'll be in a good space at that point. We didn't feel like we had too many things to check off after that. So I think after the 16th, we'd be in a good position to present again or offer recommendations.
Thank you.
So I guess looking at that, and I know we commented to our to the world, they'll be willing to pull a special meeting to look at this information, because I think it is very expedient that we look at this from a community standpoint. And so the 16th is a Tuesday. So the 17th is that, President, have any thoughts on a date for that?
President Wagers?
Mr. President.
Trustee Doan?
Yeah, I do. If they have time to put the recommendation together, I think we need to do this as fast as possible. And so I would support the 17th if we can do it.
President Wagers.
Superintendent Dennis.
I think the only concern I would have, Trustee Doan, is I think that the recommendations need to come to our cabinet first, and then from there to the reopening committee. I think I'd feel much more safe if we were looking at like Thursday, the 18th, for some of those meetings to be able to take place so that we can provide a final report as well as possible administrative recommendations to the board.
Trustee Dunn.
That's totally fine. Like I said, if they need some time to put it together, but I think he heard that we want to be urgent. So the 18th is totally fine.
Yeah, just a reminder, this is an administrative committee, which was, initiated by the superintendency. And then they do report back to the superintendent, to the cabinet. Cabinet comes up with recommendations to the board. The board then will deliberate on those recommendations from that point. So there are a few processes, but once again, we can do that pretty quickly, I think. It's not like it's going to take weeks at that point, but we do need to get our survey results back so we get information from all stakeholders. So I would maybe.
President Wagers?
Trustee Gregory.
I'm wondering if having discussed a few dates here, we can leave it up to leadership to set the date based on the preparedness of the administration, knowing that it's going to be within the scope of 4 or 5 days from the report.
Trustee Dunn.
Rather than leave it up to leadership, we're all here. Let's do it right now. Let's make a decision. Because the leadership would make it in a vacuum without us.
We wouldn't want that. But no, I wouldn't want input from all trustees. So the 18th looks like a doable day. Is everybody, and do we need a motion on that? What do you?
President Wagers, I do not know that you need a motion for that.
We just need 2 trustees that'll want to pull that date, and that could be done, to the thing. But I think looking forward, most likely we'll have a special meeting and I would like, this is a day preference. I like to do it more towards at least the late afternoon, so more people can attend. So maybe consider like a 5 o'clock, 4 o'clock, 5 o'clock meeting. That way teachers can attend as well as general public, parents, because those folks need to be involved and we need to be accessible.
President Wagers.
Trustee Oppenheimer.
Thank you. So I'm gonna go out on a limb here, and based on the information that we have heard from the doctors and the committee and whatnot, and I appreciate the call for a special meeting, certainly to make a decision to bring kids back. From what I've heard from the doctors, and I'm just looking at my notes here, looking at the mental health of our children, the vaccines of our teachers, and I'm pleased to see that so many of our teachers are getting vaccinated, and it doesn't sound like a lot of them are getting turned away. The fact that our childcare providers are serving our K through 12 or K through 2 children anyway, and it sounded to me that having children go from childcare on a virtual day back to school increase the risk as opposed to having them in a steady place. The physical distancing, I think that our K through 2 classrooms, our childcare providers are serving our K through 2 students. And oftentimes, I know our child care centers very well, and those classes are a lot smaller than our classes that we offer, our classroom space that we offer in our Boise school district. And I know that the need, the very, very extreme need that our pre-K through 2nd graders need to be back in the classroom for working families, and also the children, and online learning is very difficult for our youngest children. I would actually propose that we speed up that phase of our pre-K through 2nd grade, as well as our special ed community. And I'd actually like to make a motion to bring our special ed and pre-K through 2nd grade classrooms back in 2 weeks.
A second.
Okay, so we have a motion to bring back pre-K through second and special ed classrooms back in 2 weeks. So that would be on, I need a date. So would that be the 22nd then? So that's Monday, the 22nd, or?
Yes.
Monday the 22nd, or it'd be the 23rd.
Or the 23rd?
Yes, the 23rd.
You say the 23rd?
Mhm.
Okay, so it's been moved and seconded. So motion by trustee Oppenheimer, second by trustee Doan. So that opens up for discussion. Any discussion?
President Wagers,
Trustee Esty?
for Superintendent Dennis, what are the barriers to making that happen?
President Wagers, trustee Esty, I think a couple of different things. Number one, we understand the need to get those kids back as soon as possible. I think the first barrier that we have is the vaccination issue. We have teachers who will not be completed with their vaccinations. I think what we heard from both the doctors and from Gina Pinnell is that once we decide to come back full 5 days a week, we are at least doubling the possible exposure versus where we are today. Those mitigation strategies that we will need to have in place in order for us to continue to see the successes that we've seen in our buildings. I think that is a potential concern. And probably lastly, I would say that the committee has done a lot of work up to this point. I think they are on the verge of being able to provide us some recommendations and a report on that, which includes exactly where not only our teachers, but our parents and our students are in some of this conversation. And I would think that the board would want to get all of that information before we start making a move that I would hope we can do without causing our district to go backwards in some of this. That would be my concerns as far as the barriers. To answer your question, trustee Esty.
Follow up.
Go ahead.
If the committee were to come back on the 18th and recommend that we move forward with it, at a minimum, bringing K2 back in special ed, how long would it take us to do that? Would that take another week? Would it take another 2 weeks? I realize you have to give people some notice, but
Superintendent Dennis.
President Wagers, trustee Esty, I think there's always going to be a 2-week delay with food service. Ordering the food is always going to become an issue for us as far as a 2-week out issue. Can we speed some of that up? Yes. As far as the other issues that revolve around the 2 weeks, the hiring, the bringing people back off of furlough, we've already begun starting to work on some of those issues. So those kinds of things are always going to be, I wouldn't say barriers, but can I see that something happening on the 18th where the board makes a decision potentially on a hard date, then we'll be able to meet that date once that decision is made. Does that answer your question?
it does. Thank you.
Any other?
President Wagers.
Trustee Greeley.
Thank you. I hesitate to move forward without getting some feedback from after the meeting on the 16th for a number of reasons. One of them was because at the beginning of the presentation, Director Anderson and Stephanie were talking about the recommendations as to how to return, and is looking at doing it as safely as possible. I think that's a really important aspect of the work that the committees are doing. I think it's really crucial that we hear the input from all the stakeholders, teachers, parents, students, prior to making a decision that we're going to move forward. I think one of the other aspects listening to the logistics team was allowing the teams to address the changes that need to be made. Can they be made in the 2 weeks? I don't know, between now and then, but it goes back to me for the very point of it's so important to everyone that we provide consistency and predictability. And I don't want to put us in a situation where we can't be consistent or predictable when we haven't received the information that I think is really critical that we've tasked the committee. Well, we haven't tasked the committee, that's the Superintendents Committee, but I think those are really important pieces for us to be able to make a decision on how to do it safely and how to implement bringing students back.
Thank you, Trustee Greeley. Any other trustee input?
President Wagers.
Trustee Gregory?
I share some of Trustee Greeley's feelings in my impression was that there's still a substantial number of unknowns associated with the data that the committee is looking at to see what things need to be mitigated in terms of social distancing and barriers, working with barriers that are existing in our buildings. And they differ from different parts of the district, where we have older buildings that may have smaller classrooms. We have different size buildings that are bigger classrooms, et cetera. And to say blanketly that pre-K through 2 could be, doesn't have some of those challenges, I think is a little short-sighted, because some of those rooms could be among our most challenging. Also recognizing that our district has reached out to the most needy of our special ed and underserved or lower populations, as in special needs populations, and are providing services on a case-by-case basis and covering those greatest needs at this time, and giving the system time to build up the capacity to determine the safety of how we bring these kids back, I think is worth letting the committee bring forward their recommendation. Thank you.
Thank you, Trustee Gregory. Any other?
Yeah. Thank you. I actually walked in today very strongly feeling that we need to move to 5 days a week in-person learning. I know that most of us in this room feel very strongly that as soon as we can possibly move to 5 days a week, we should, because there is such an outcry from families in our community. As history, I'm a mother of a special needs child and a working mother. And I know that I'm not alone in this community for having had to make huge sacrifices for my family that we will have to pay for years to come. I'm also aware that the parents that we hear from on a regular basis are able to commit the time and communication to be able to give us their opinion, and that there is a huge silent majority who are too busy and too stressed to be able to do that. I am interested in finding out more about what these parents think. I would just urge them to respond to the survey, because it may be a way that is a low enough bar that they can communicate with us. I do think that today I walked in sure that, I wasn't sure what I would hear, but that I know I want 5 day a week school. what I heard from our doctors and from our community leaders told me that a thoughtful process is the best way to get there. Get to a 5-day-a-week school day, and it might actually be one that sticks around for longer. So I would just urge us to consider looking at the survey results. That said, I very much want a 5-day-a-week return.
Thank you, Trustee Langley. Other trustee debate? I mean, I'll make a few comments. There's lots of frustration out there. We received, let's see, over this board meeting, I think it was 150 emails plus. Once again, we did read them all. Lots of folks, you know, there's stress in families, there's stress in students, there's stress in teachers. So it's on all sides that we're facing. I mean, teachers would love to be back 5 days a week because they wouldn't have to do 2 preps, one virtual, one, you know, one in class. It's an incredibly frustrating time for all. But that being said, you know, we had doctors that told us no today, flat out, don't go back to school yet. Both of them, both doctors and Central District Health said no. We are trying to adapt, I think, to the special ed. Sounds like, not fully though. I mean, it's never enough. And the vaccines for the teachers are taking place, which hopefully will get that number of staff much closer to 0. That doesn't mean transmission doesn't take within the classroom and then they take that home to their parents who aren't vaccinated. So once again, no perfect answers. I would like time to evaluate classrooms to make sure that we haven't fully done that yet, but we can socially distance at least to a specific level and have the chance to train our staff and our administration to do those things as well. But I definitely hear the frustration, and I think echoing Trustee Langley, we wouldn't be having these meetings if we didn't all want to get back to 5 days a week. I mean, I think almost everybody in this district wants that to happen. I want that to happen because we know that's where the best learning takes place. We know that's where we solve mental health issues. We know that's where we solve child abuse issues because our teachers see those things happening. I don't know. It's just hard. But that's my debate. Any other trustee debate?
President Wagers.
Trustee Langley.
I just also want to say that I'm glad to see that we have made steps to move forward with our most vulnerable populations, special needs, English as a second language. And I just would commend the district for having gone forward with that without the board's encouragement that you guys took that upon yourselves. And I would just like to see us continue on the path of being outside the box thinkers in those populations. You know, no matter what happens in our community, that we continue to address those communities separately from the big boat that we try to turn as fast as we can, but that we sometimes can't get to turn as agilely as we'd like.
Thank you. Trustee Oppenheimer, did you have a last thing? I thought I heard you.
Oh, no. You know, I did hear the doctors and I heard them loud and clear. I also heard that there were a lot of unanswered questions. I am coming from the lens of our youngest children and their families needing to be in a safe environment, in that safe environment consistently. And I also heard that the risk is very, very low, especially in those younger classes. You know, like I said, our childcare providers are serving these children, and we're not seeing a lot of spread, if at all. there's not even like enough data to show that we're seeing that. And I just feel like that is a step in the right direction. And I get it. We want to hear from our constituents, and we want to hear from our families, and we want to hear from our teachers. We have heard from many, and President Wagers, you mentioned that we had 150 emails to them. The majority of them, the overwhelming majority, were to bring our kids back 5 days immediately. I'm not ready to bring back all of our grades back 5 days a week immediately, but I am ready to bring back our most vulnerable and our youngest children who absolutely need to be in our classes. So that is why I made the motion, and I will stay with that. Whatever happens and whatever the outcome, it's okay. This is why we all have our opinions, and we hear things, and that's okay. But I feel that it's important that we be a voice for those youngest children who sometimes don't have a voice and need to be in school.
Thank you, Trustee Oppenheimer. Any other final debate? If not, we'll move to the question. So the motion on the floor is to bring back pre-K through 2nd grade and special education back 5 days a week, starting Tuesday, February 23rd. So all those in favor?
Aye.
Aye.
So I've got Trustee Oppenheimer and Trustee Doan. Are there any others?
Aye.
What? Trustee Langley? Okay. All those opposed?
Aye.
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 Aye. So motion fails. Okay. Next on the agenda is the budget schedule and enclosure 20.
President Wagers, trustees. I believe it is enclosure 20 as stated. So I am requesting approval of the following budget development schedule for the 2021-22 fiscal year. We begin on April 30th with a budget session workshop. Then on May 10th, we would have our second budget session regular board meeting. Approval of the budget for advertising, first public input would be on that date. At that time, we would also get the report from the Ada County Assessor's Office. We would follow that up if needed with a board workshop on May 28th. And then the regular board meeting with the budget public hearing would be on June 14th. And final approval of that would include final approval of the budget for the 2021-22 school year. This is really right in line with the what we've done several years as far as our budget development schedule.
I would entertain a motion on accepting the budget schedule as in enclosure 20.
President Wagers,
Trustee Greeley.
move approval of the budget schedule as stated in enclosure 20.
Is there a second?
I'll second.
Second from Trustee Oppenheimer. Any discussion? All those in favor?
Aye.
Aye.
Aye. Any
Aye.
opposed? Motion passes. Next, we'll go to the prioritization list of ACHD projects in enclosure 21. I'm guessing Lynette Daw.
Yep. Good evening, President Wagers, Superintendent Dennis, trustees. Each year we have the opportunity to submit a list of Boise schools' priority infrastructure projects to ACHD as part of their community programs process. So enclosure number 21 is a list of our prioritized projects, considering factors such as safe routes to school, number of students in the area, the ability to eliminate busing, and project complexity. And so at this time, I'm requesting board approval of our project list as required by Ada County Highway District.
Thank you, Lynette. Would entertain a motion, then we could have discussion if needed.
President Wagers,
Trustee Gregory.
I move approval of the projects as outlined in enclosure number 21.
Is there a second?
Second.
Second from Trustee Greeley. Is there any discussion on the projects outlined in enclosure 21? Seeing none, proceed to a vote. All in favor?
Aye.
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 Aye. Any opposed? Motion passes. Unanimous. That figures up reports and recommendations. We'll go on to E, other business. We'll start with policies and Director Anderson.
Good evening still. Hi. We just have two policies up for first read. Policy 1125, board commitment, and policy 1126. Anybody have any questions?
I believe we went through these at the last meeting, but this will just be the first reading, and then we'll have a chance to comment. You can still comment back to Director Anderson or the Governance Committee, and then there'll be a second reading at the next board meeting.
That is correct.
Any other questions, comments? No? Okay.
Thank you.
And we have no second readings. So that moves us on to Trustee Board Superintendent Comments. Any comments from either the superintendency or the
President Gregory or President Wagers? Sorry.
Oh, President Gregory, go ahead.
Sorry. So I wanted to remind everybody the opportunity to participate in Day on the Hill this coming Monday. It's going to be shortened and virtual with an opportunity to hear a couple of panels that will talk. They've really kind of focused their topics and made them pretty relevant to what's going on right now. We continue to watch the legislative session. There's been some highs and a lot of lows, and people, they're just still trying to figure out what's going on, I think. And we have some real supporters of education and who are really working to bring forward some legislation that's good for legislation. And we have hopes that, the goals that the governor outlined in terms of career ladder and funding for schools and stuff will be successful. And those are the things that ISBA is working on. There are some fairly alarming pieces of legislation going through. One of them is the concealed carry weapons on campus. And we fought this fight last year. We're still fighting it this year to leave that in the purview of local boards to make those decisions for their local school districts, which is something that's working very well across the state. We do have some very small, rural, remote school districts who have teachers or staffs who carry, but in our population, that has never been the will of the board. We are hopeful that we'll get some traction on being able to handle disciplinary action for students in executive session, which is, Idaho is a little bit of a rarity. There's not a whole lot of states that still insist that that be an open session, and we think that that's a win for this year as well. And we're also watching the monuments piece of legislation and being very thankful that we moved on Boise High when we did, so that we wouldn't be constrained by the legislature in another local control issue. So anyway, long and short of it is, look at your schedule on Monday and see if you can join ISBA for Day on the Hill. And just wanted to bring that to your attention. Thank you.
Thank you, Trustee Gregory. All the trustees are registered for that, so you should get emails. You can attend, the Zoom meetings as needed. Any other superintendents? He's got nothing. I would just like to thank the board. I know you guys are putting in tons of hours, tons of work. You're following, you're respectful. We have good debates. Everybody's thoughtful. Turns out there's no real right answers. And everybody's struggling. And I appreciate, the desires that every board member has. So thank you for that. And thank you for the committee for doing the amount of work that they're doing, because once again, a lot of chunk of volunteers who didn't know what they signed up for, and would like to thank them for that work as well. That being said, just like to remember, we're educating today for a better tomorrow, and it is going to be a better tomorrow. Trustee Doan, do you have anything to say?
Move to adjourn.
That's what I thought. Is there a second?
Second.
Second from Trustee Gregory. All in favor?
Aye.
Aye. Have a good night, everybody.
Thank you.